Meeting. It is 9:01. Please stand with me for the Pledge of Allegiance and remain standing for the invocation by Pastor Lonnie Skiles of Big Valley Grace Community Church. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you for the privilege this morning. I'm going to read briefly out of Proverbs chapter 8. Wisdom is personified. It says, "Now therefore, O sons, listen to me." This is wisdom speaking. "Blessed are they who keep my ways, heed instruction, and be wise, and do not neglect it. Blessed is the man who listens to me, watching daily at my gates, waiting at my doorpost. For he who finds me finds life and obtains favor from the Lord," which we want. Let's pray. Father, thank you. How great is your name, O Lord, our God. King of kings, Lord of lords, the creator of all that we have, every one of us, Lord, you have made us, you have made us. We are the sheep of your pasture. Your earth and everything in it belongs to you. And Father, you encourage us to seek wisdom, to seek after it more than anything else, and I pray that you would be.
Council Bose, thank you very much for the opportunity to be here today for a presentation on Behavioral Health Awareness and Prevention Month. And I'd like to thank the board for last week's proclamation recognizing May as the Mental Health Awareness Month. With me here today, I have the Associate Director for BHRS, Mr. Kevin Pignon, who will also assist with the presentation. Who are we? We are one of the 58 behavioral health agencies in the state that are the safety net for behavioral health individuals. And we provide services for uninsured and underinsured in California from early childhood through end of life, funded through Medi-Cal and other programs. We provide various of services to make sure that they are receiving both housing and the mental health services. We have worked a lot on increasing our permanent supporting housing stock. I believe we have about 99 units currently. And this year, I'm proud to say that through the work with our partners, both city and other nonprofit organizations, we are working on developing another 112 housing units in various levels in our community, most of which will come online within this year. So that's a great stride. We, of course, know that behavioral health treatment that is voluntary is the most effective avenue for healing and recovery. The national best practices by American Society of Addiction Medicine conclude locked, coerced, or other forms of involuntary substance use disorder treatments have not been proven to be effective treatment models. Voluntary, evidence-based treatment is not only effective for long-term recovery, but prevents additional potential harms. We also deal with workforce issues. Those are challenges that the safety net continues to have. And we continue to look at strategies within our county with the support of our board and other community partners to reduce some of those obstacles and increase our workforce stock. We have implemented strategies that have contributed to reduction of that shortage, and we continue to work on new strategies to further complete and fill that gap. Care Court is another process that is being phased in with the first cohort of 8 counties representing a majority of California population starting in October 2023 with the first cohort and then the full implementation by December of 2024. The counties, of course, welcome the opportunity to create more resources and ways to deal and support the needs of those individuals with schizophrenia and psychotic disorders. We all know that that is not the only solution for our homeless issues and any kind of a challenge that we may have with individuals who may not be aware that they need the services. However, we know that it is a great tool that will assist us in moving forward along other tools that we're using. So proud to be one of the first cohorts that has engaged in this, which has actually put us at the table to work with the state to create the process that will be also followed by other counties. This year's mental health campaign is focused on how our surroundings impact the mental health. So we're really asking individuals to look around. Look around for safe and stable housing. Look around for healthy environments, whether that is at work or at home. Look at neighborhoods and towns, the outdoor and the nature. Really take charge of our surroundings. We need to take charge of our surroundings in favor of well-being. So we need to be really focused on here and now. What is it that we can do here and now to make a change that will be a positive impact on our mental health and mental health as those that we love. So definitely we need to then be aware that what we think translates in what we feel and translates into what we act. So thoughts, feelings, and actions go hand in hand and affect each other. That's why we also continue to talk about being mindful and being mindful of what we do, what we say, how we do things. And I want to invite our community to continue to do that. Mental health is really a wealth, and we cannot take it for granted. The stigma continues to exist, even though this is something that we've been working on for years and years. People are still hesitant to seek help for themselves or their loved ones, even to talk about what's going on to their own loved ones, because they're being fearful of being judged or being fearful of seeing unnecessary backlash. Simple logic, of course, dictates that if we are hurt anywhere in our body, we must seek treatment. We seek treatment to get better, but this also applies to both physical and mental health, right? But we need to continue to emphasize that head and body are connected. We need to continue to emphasize they go hand in hand. I want to appreciate and thank our partners. We have established great partnership with both public and private sector, with our law enforcement and justice partners, with our health plans, with our community organizations that all work along our side to support and meet the needs of our community when it comes to behavioral health services. We continue to work together to reduce unnecessary hospitalizations, to reduce unnecessary crises. We also have a great partnership with our justice partners, looking at diverting individuals who actually may be engaged in small types of crimes that may be driven by their mental illness, and diverting those away from justice systems into treatment, because that is something that we can actually count on in long term. So I want to thank our partners, all of them, who many of which are here today, for the work that they do with us. I want to also ask our community to work with us on continued education of individuals in our county about how to recognize symptoms of mental illness, signs of mental illness, and work with us in prevention and early intervention. We need to continue to inform the public on how to access the behavioral health services early on, not when it's time of crisis. We need to continue to focus collectively at every sector on two things that are detrimental during our behavioral health crisis that we're dealing with right now. One is the stigma. We need to collectively at every sector work on reduction of stigma. That is the biggest thing. The second thing that I'm going to illustrate to you is we need to collectively work together on cutting the red tape when it comes to behavioral health services. So I want to invite every partner at every sector to do that, because things get sticky when there's red tape, right? So, but that is something that we continue to deal with, because when we're trying to build urgent behavioral health services, when we're trying to make an impact at every sector, we often come together or come across, old paradigms, old processes that delay what we're trying to do. So today my ask is, please help us with reducing stigma, and please help us cut the red tape at every sector in our county, whether you work for county, whether you work for private sector, city, any sector, please help us. Thank you very much. I want to hand it to Kevin to give us a highlight about some of our behavioral health services and what we've been doing. Kevin.
Thank you, Tony. Just want to echo Tony's sentiment about appreciating the community and also our collaborative partner. Many of them are here today. Center for Human Services, we have Sutter Health, and some of our and health plans are here, HealthNet, and then Health Plan of San Joaquin are also here today as well. And I also want to thank all of our staff who are here today, who's been in the front line day in and day out to serve our community. So I want to call our Access Crisis Support Line staff, our prevention teams here, and also our SUD prevention, SUD services, and behavioral health services team are here as well. So I want to thank all of them for all of their hard work and commitment to serve our community. And it's my pleasure to be here today to really, it's an important day for us for behavioral health and recovery department, and to really recognize that mental health affects all of us, and substance use disorder has impact all of us in this room. So if you're struggling with SUD issues and experiencing mental health symptoms, you're not alone. So the earlier you seek help, the better the outcome. So I encourage you to please reach out and seek help. And it's also my pleasure to be here today to give a brief overview of our behavioral health continuum of care, and also to give a quick highlight of the number of people served by BHRS in the last fiscal year, and of course to remind folks in the community how to access behavioral health services. The behavioral health continuum of care includes our prevention team. Our staff continue to engage and educate the community about signs and symptoms of mental illness. As Tony had mentioned, sorry, I can't multitask. My apologies. As I mentioned earlier, behavioral health continuum of care include our prevention team. They are continuing to engage and educate the community about signs and symptoms of mental illness, and to make sure that folks know how to access services. I know that Tony has mentioned a little bit about recognizing the signs and symptoms. So these include like changes in behavior, people becoming more withdrawn, changing their daily activities. This is what some of us in the field refer to as anhedonia, and that is a psychological condition that is characterized by the inability to feel joy and happiness. So it's important that folks recognize that. Some of our prevention strategies include community events like the town hall meetings, fentanyl awareness events, suicide prevention training, and mental health first aid training, stigma reduction, and of course our social media campaign. As you can see, this slide here shows the continuum of behavioral health care services from mild, moderate to severe. And for individuals experiencing mild, moderate behavioral health symptoms, those folks can access services through our managed care partners like Health Plan at San Joaquin and HealthNet. Both health plans are contracted with the Department of Healthcare Services to provide services to individuals experiencing mild and moderate behavioral health conditions. And of course, on the other spectrum is what we refer to as severe, and that's individuals with serious, persistent, and complex mental health conditions. And those folks can access services through BHRS. We are contracted with the Department of Healthcare Services to serve individuals with serious and complex mental health needs. And this slide gives an overview of our children's and transitional age youth system of care. Within children's and TARE system of care, we have a children's mobile assessment team whose primary role is really to conduct mental health as comprehensive mental health assessment and care coordination. Within the system of care, children's system of care, there are strategies and services which includes crisis stabilization, continuum of care reform, mental health services, partnering with child welfare and probation, assertive community treatment, intensive community support, early intervention, and specialty mental health services. Underneath that, you'll see the dark blue box, and that represents our county-operated programs. And then the lime green, which is appropriate for today, it represents our children's contracted providers. The next slide gives a brief an overview of the adult system of care. Within the adult system of care, like children, we do have the adult medical assessment team. That team, again, their primary role is really to conduct a comprehensive assessment and provide care coordination when someone is seeking services. And some of the strategies and services that's available under the adult system of care include assertive community treatment, forensic services, intensive community support, outreach and engagement. And under outreach and engagement, we also have a assisted outpatient treatment program, also known as Laura's Law. And my apologies, somehow we missed that. We didn't put it on, it was not included on there. So, and like children's system of care, the dark blue represents our county-operated programs, and the lime green are the adult contracted providers. And then to support children's and adult system of care and SUD system of care as well, we have community emergency response team who provide crisis evaluation. They get called out in the field or to the ED emergency rooms to conduct crisis assessment. And then of course we have the supportive services division and Office of Public Guardian who work alongside with the adult system of care. And of course, support services division also support children's system of care as well. The next slide is an overview of our substance use disorder system of care. Within the SUD system of care, we have Medicare Access Care Coordination Team, whose primary role is we conduct SUD assessment and also provide care coordination to folks in treatment and seeking treatment. Some of the strategies and services under SUD system of care includes residential treatment, withdrawal management, outpatient services, recovery residence, medication-assisted treatment otherwise known as MAT, Youth Services, In-Custody Services, Prevention Services, and the newly added Evaluation and Medication Access Clinic. Again, all the blue squares represents our county-operated programs, and the lime greens are contracted provider, which includes Nirvana, Center for Human Services, Redwoods Center, and Recovery Medical Group. The next slide here shows the number of people served by behavioral health and recovery services in fiscal year 21-22, and it's broken down by system of care. The adult system of care served 2,566 individuals. Children's system of care served 2,836 individuals. Substance use disorder served 3,292, and then community emergency response team served 2,161, with a combined total of unique individuals served in the fiscal year 21-22, 9,422. The next slide shows it's a 5-year comparison going back to fiscal year 2017-18, which we served 10,942 individuals. And the next fiscal year, 18-19, we served 10,677 unique individuals. Fiscal year 19-20, we served 10,068 unique individuals. Fiscal year 2021, we served 9,000, looks like 615, I'm sorry, I have a hard time seeing that, individuals. And then fiscal year 21-22, we served 9,422, as I mentioned earlier. And of course, the next slide shows the number of calls our access line and crisis support line received since we merged the two lines. In July 2022, we merged our access and crisis support line to co-locate at the Community Emergency Response Team, so we have one call center. Since the merge, we received 4,491 mental health calls, folks seeking services. We received 2,625 substance use disorder related calls with a total of 7,116. And that's from July 1, 2022 to March 31st, 23. And the next slide shows our famous rainbow slide. Many of you have probably seen this before. Our prevention team and our access crisis support team continue to educate the community on how to access behavioral health services. So in this slide, it shows that if you have private insurance, you can call the phone number on your insurance card and ask for behavioral health services. As Tony mentioned earlier, a lot of our private insurance, commercial insurance, are now providing coverage for behavioral health services. And we have Medi-Cal. You can either call Managed Care Partners Health Plan of San Joaquin at 888-581-7526, or HealthNet at 800-675-6110. And of course, our behavioral health access line with BHRS at 888-376-6246. And that's for folks seeking mental health and substance use disorder. And if you have Medicare, you can call your Medicare provider to access services. And if you have Medi-Cal, Medicare, you can call our access line, again, 888-376-6246, and that's for both STD and mental health services. And then for folks who are without insurance, you can call our access line at 888-376-6246. And of course, for folks who are struggling with behavioral health crisis and having thoughts of maybe suicide ideations or thought of self-harm, you can call out dial 988, which is our suicide crisis lifeline. And of course, you can also call our access and crisis support line at 888-376-6246. And again, this slide is just a reminder, the phone numbers that you can call to access services and crisis support.
Thank you, Kevin. And I just want to highlight something that's up today. I want to thank City of Modesto for partnering with us on putting a large bulletin board on Highway 99 with no cost to do prevention and also educate individuals on our crisis lines. So as you're traveling on Highway 99, individuals will start seeing how to access mental health services through the county crisis support line. And we really appreciate that type of partnership. And that's really the important piece, is it takes all of us to do prevention. It takes all of us to take care of our community. And I'm so proud to say that working with every sector, we continue to see that. We have a lot of, as you saw in lime green, we have a lot of partners who actually partner with us to make sure that we fill the gap of behavioral health services. And without those partners, this mission would not be possible at all. So I really want to thank all of them. And just to really quickly, in closing, highlight that we are working on multiple initiatives right now. As you all have heard, the CalAIM is there and it's happening, and we continue to work in close loop on those processes. But you know, the department's going through conversion to a new semi-statewide electronic health record that was approved by the board. Looking at the care court that I mentioned, the care court and care act being the cohort, the first cohort, but also looking at new mental health and collaborative court redesign, working with our justice partners to ensure that we make the processes in our justice system and court system when it comes to mental health courts as seamless as possible, and intervene early on to reduce any kind of a wait time and delay in services. We are working now on an initiative to reduce individuals who end up in Department of State Hospital as incompetent to stand trial. That is a partnership that we are doing together with the DA's office and public defender courts and sheriff and law enforcement partners. We think that is a very important piece, because getting in front of those interventions and providing the service and reducing that dependence on the state Department of State Hospital and sending people to state level for treatment, it's going to be important. So we're going to reduce that. And of course, looking at the housing continuing expansion, that's an ongoing process. And you know, the one-stop supportive services campaign and campus that was approved by the board, that is moving forward, and we continue to work on implementation of that. We are working on a 3-county crisis continuum for children's service system of care, and soon we will be coming here to the board to do a presentation with our partners. That is a very exciting project, again, to keep our kids in our community for treatment and do early intervention of treatment for our children, where today in many counties those kids go to limited resources that are out there to receive that treatment. And of course, our 24/7, 365-day mobile crisis continuum, as you know, the 988 process is coming forward, but also there's a mandate for counties to provide 24/7 mobile crisis teams. So we're working on expansion of those teams across our counties so that we provide timely intervention. We have engaged our peers and the peer support certification. It is important to have peers involved in our systems of care where they are working alongside individuals who particularly have challenges or experiencing mental illness or substance use disorders for the first time. And of course, we are working on new statewide Medi-Cal quality standards where we will be able to compare ourselves across the state with other counties as the state starts putting those measures together. We will be in line with that. And as I mentioned before, we are collectively working this year on a countywide suicide education and prevention plan and coalition that will bring in all partners to do early education and prevention for suicide. And then, of course, continued efforts are in our prevention services division, which looks at interventions with substance use disorders, issues with our mental health, and of course, the major crisis that we're dealing with fentanyl. And so a lot of work is being done on that through our division as well as our coalition here in Stanislaus County. And of course, we will be having a presentation today on countywide substance use disorder services expansion project, which we're excited to give to the board. In closing, I just want to thank the opportunity for our staff to be here and present this information to you and to our community, but also thank the board for their continued support and the vision, as well as the CEO's office. We cannot do this work without your support. Want to thank our community partners, justice partners, many of which are here today. And I would like to, when the chair sees fit, we would like to call them up here and make sure that they are all recognized in our partnership. And with that, I want to thank you again for this opportunity and the moment to present.
And if you have any questions, we'd be more than happy to answer your questions.
If I could chance, maybe just real quick before you do your presentation, just say a couple things. First, Tony and Kevin, thank you guys. Great presentation here. And I know we took a long time on this, but it's time well worth it. And we look at our budget, that what we spend on and BHRS, our mental health department, it's probably the second largest chunk, $160 million or so that we spend in this county. It's worth the time to sit here and talk about what you're doing and the things you guys are accomplishing. So I want to thank you on that for all you've done. All the presentation here was great. I sit on the mental health board. I've been on that since I first was elected to do this, and it really was, I think at first the new guy is who they always put on the mental health board, and that's how it started. And I can remember the first meeting that I sat in, and I was just amazed. An individual stood up and talked about how the government was controlling his mind and things were going on. And I started to kind of chuckle, but I looked around and nobody was laughing. There was nothing funny about it. I realized very quickly what was going on there. And as you guys say, it's the stigma that we need to get past, because so much in the past has been mental health issues. You have a weakness, there's things like that. There's no difference. You break your arm, you get a cast, you fix it. You get cancer, we treat cancer. You have issues going on in your brain. Mental health issues are no different. And I can say that we're all screwed up. Okay, and I guess I can say that. We're all screwed up. We've all got issues, right? And there's nothing to be embarrassed about. There's nothing wrong with that. We all have different degrees of it, but whether it's mild to moderate or severe. And so there's things that we have to do to deal with that for the sake of the individuals that have it, for the sake of all of us around that have to live with individuals that have that. So we've got to get past the stigma that we talk about all the time. Very proud of everybody who's here. I thank everybody who's here a part of this, whether you work for BHRS or you work with BHRS. You guys are doing yeoman's work, and we're very, very much proud of the work you're doing. In this county, we lead right in the state. It's what we do in Stanislaus County. And I look at even the CARES Act that that's being we're putting that in place here, and we are one of 7. There's 58 counties, and there's only 7 in this state that stepped up to do this. And so proud that you guys in this county, that we stepped up to do this, to be part of the pilot program, to do that starting in October. So very big deal. Not only do we deal with severe mental illness, as you've talked about here, but the mild to moderate. We are working hard now. We're working with our school systems, right? We're trying to get to kids before they become with more severe issues. And so very proud of that, of the work that you guys are doing. There's so many good things that you're doing that affect every one of us in our everyday life, whether we know it or not. The work that you guys do here really makes a difference in our community. So, and all the partners you have, what we're dealing with the CARES Act, you know, our DA, our public defender, you know, our court systems. Ruben Villalobos, one of our judges, has been very active as we try to implement this, put this in place. And of course, everybody at BHRS. So, and then I look forward to the item that we have coming up on our agenda that's going to, like you talked about, substance use disorder. So couldn't be prouder to be a part of what you guys are doing. I'm going to stay on this committee, and they're going to take me away kicking and screaming if they ever want to get me off of this thing. And just, I very much thank you guys and all of you here who are here today that represent individuals that are making a difference in our community and dealing with mental health. So thank you, Tony, for everything you're doing.
Thank you very much, Supervisor Withdraw.
Yeah.
And we appreciate your support.
Tony, it's yeah, so please bring them up, please. They can come up while I'm speaking.
Just like to ask our staff, our partners, please step up here to receive the proclamation with us. This belongs to all of us.
Absolutely.
This is a collaborative work that we do, and we are strong partners together. I want to thank our staff. We are so proud of our staff for the great work that they do, and we cannot do this without our staff who are the backbone of the department. Thank you.
Hey, Tony, lift the stanchion, you can let them pile in back here, too. You can let them pile in here.
Hey, Corinne, how you doing?
Yeah, for a photo, yeah.
Hey.
Come on.
Good, how are you? How you doing? Good morning. How are you doing? Hi. How you doing? Good morning. How you doing? Hey, Olivia, how you doing?
We're setting the Guinness Book of World Record for the biggest frog. There you go.
How you doing? Of course. Good morning. Appreciate all you do. How you doing? Good morning. How you doing? Good morning. Yeah, you got your work cut out for you. You're gonna need a wider lens. What do they say, panoramic? Good morning. See ya. All right.
What's up, John?
We can show our collaboration by lining up really fast.
Well, you know the phrase, it takes a village. Well, the village is here today. So, and there's no truer statement. I mean, this is such a multifaceted, complex issue that we face on a daily basis. And on behalf of the Board of Supervisors, we want to express our sincerest gratitude for all the work that you do for us and for our most vulnerable populations. Again, we are fully in support. I know we have been supportive of putting tools in your toolbox, and we will continue to do so. And if you can show us where the red tape is, at least on the local level, I know we'll bring the scissors.
I've got the scissors.
There you go. So again, thank you for all the work you do. It's an honor to proclaim the month of May as Mental Health Awareness Month.
Thank you very much.
Okay.
There you go, perfect. You're fine, Tony. Okay, I'm gonna count to 3. 1, 2, 3, one more. Got it. So who's there to declare? Okay. Thank you.
Thank you so much.
Of course. Thank you, guys. Thank you.
Thank you, guys. Thank you for coming.
Yeah.
Thank you, guys.
Thank you, guys. Appreciate it.
Thank you so much. Thank you. Thank you, guys. Thanks for coming down. Thank you for coming, guys.
Thanks. Appreciate it.
Thanks.
I want to see you put the blue ones on.
Sheriff, good seeing you. Just like that green.
I hope Erica had a panoramic lens on her camera to get everybody in there, but that was great. Wonderful presentation. Thank you, Tony. All right, moving on to an update on the local emergency due to the winter storms and flooding impacting Stanislaus County. Looks like we have Sheriff Dirksey is going to give the presentation.
All right, good morning. Thank you, Mr. Chairman, members of the board, Mr. Hayes and Mr. Bose. So just a quick update on the state of emergency. As you know, we are still in a state of emergency due to the flooding and the specific issues that our rivers are so high. And we don't foresee that changing anytime soon, and we still have folks who are under an evacuation order as a result of that. So no real change to the state of emergency, but what I want to specifically address this morning is the status of our rivers when it comes to recreation. There has been kind of a statewide warning to folks not to recreate. It's not an order, but it is a warning on the rivers, given the flow rates and the dangers with that. Some of our adjacent counties have actually closed all of their rivers and their waterways to recreation, just due to the threat of loss of life, drowning specifically, and the challenges with any rescues given the flow rates. That is not something that we are going to do here in Stanislaus County. We've had various conversations about it, looked at all of the risk factors associated with it, but I will be honest with you, I struggle with the issue of closing avenues of recreation to our community simply because the water is high. I mean, there are many folks that are quite excited about these flow rates, right? I mean, if you're into whitewater rafting or whatnot, this is what you look forward to. And we have businesses that would be severely impacted if we took that measure. And so we have no intention of doing that. However, we also need the public to understand the threat that they face if they get onto the waterways without the proper training, experience, and equipment. We have had several river rescues already this year, and last weekend was fairly warm and also fairly uneventful. The weather today is a bit cooler, and so we don't foresee it as being an issue at the moment. But we need people to really evaluate whether or not they should be on the river or even near the river's edge. Last night, our helicopter went to Calaveras to try to rescue a gold miner who fell into a river up there and was washed downstream. He made it across the river. We were unable to get him based on where he was at, and he has subsequently been rescued, but the rivers are extremely dangerous. So we are going to increase our messaging fairly dramatically this week. I actually filmed the video yesterday. It will be posted probably about the time I'm done talking here onto our social media. We have had some signage made that will go up at all of our access points, specifically to the Tuolumne and the Stanislaus rivers. Encouraging people not to get on the water. But what it really comes down to is if you don't have the training, the experience, or the equipment to get on their waterways, don't. If you want to recreate on our waterways and you don't have those items, I would encourage you to, if you can afford to do so, hire, a contract with or pay to go on an appropriate company that allows those sort of services, and they know what they're doing. But whatever you do, do not go to Walmart, buy a little pool toy, and decide you're going to float down the Stanislaus. It will be a recipe for disaster. And the final note on that is I have directed my staff that if the conditions are not safe, that they will not attempt rescues. So the public needs to understand that if they find themselves on the waterway and they get themselves in trouble, if the conditions are not safe, we may not be able to come and get you. So that's really it. That's the status of the update. Pending any questions from you. So.
Any questions? Vito?
So I just have a comment because there was a great article in the LA Times. They did the snow survey, and only 12 inches of snow melted, the equivalent, the water equivalent, in April. And in the southern part of the valley where the worst flooding is expected to happen, there's still about 51 inches to come down the mountain. And it is, when you talk about those types of numbers and getting the water through the system, there they don't have any place for the water to go. We have somewhere for the water to go, but unfortunately, we've been running at flood level on the San Joaquin. I think you're about 6 inches away every single day. And we have essentially the same type of issue. I think we've got about 45 inches of water to come down. So you can hope for cool weather so that we can get it through the system, but that's just not the case. It's not going to happen. It's not how we're built. And so there's an expectation that there's going to be flooding from now till, I would imagine, till August, and in differing degrees. So
We are planning right now that the flow rates will stay with what they're at least through the 4th of July, and then, maybe longer.
Sheriff, thank you for the info. I know in District 1, Fire District, Stanislaus Consolidated, Oakdale have life jacket loan programs. Can you work with them and maybe get that message out?
Absolutely, we can do that. And that actually reminds me too, our River Patrol team officially starts May 20th. The board approved that last year. We've added additional staff. We have a super sexy boat that's going to get unveiled very soon. That was also part of that funding stream, and it is sexy.
is
and
it a submarine? It should be a submarine at this point.
It's not a submarine, but I have seen the graphics on it, and it is very appropriate for the 4th of July, shall we say. But it is an incredible tool for us to get on the rivers. And in addition to the life jacket program, we'll work on that. But I failed to mention that earlier, that we will be out on the Stanislaus and the Tuolumne rivers consistently every week patrolling those.
Perfect, just in time.
Yep.
Thank you, Sheriff.
All right, thank you.
Appreciate you. Thank you. All right, moving on to public comment. For those who are in attendance for public comment, please state your name for the dais and keep your comments to a 5-limit marker so that we could be fair to all the speakers in attendance. I do have a couple comment cards. The first card I have is Mr. James Castillo. James, good morning.
I'm James Costello. I live in Ceres. I'm here to introduce a committee that we have formed through the auspices of the Modesto Peace Life Center. It's called the Modesto Citizens Action Group. It's a group of citizens supporting and persuading our elected officials to increase the number of non-market housing stock by providing simple, basic, temporary housing for people who are homeless living on the streets. This would be classified as Tier 1. Interim supportive housing is a stopover between the streets and permanent housing, a place where people can get out of survival mode, take a breath, have mental and emotional capacity to focus on stabilizing and rebuilding their lives. And of course, these are the very small shelters that many of you know about. Of course, doing this requires intense supportive services. You can't just throw people in houses and expect things to work out on their own, and I think all of you know that. We are urging the county and the city to work together to do this, and it looks from what we are hearing so far that may actually happen. There's a lot of positive energy out there to try and solve this problem. We think there's a humanitarian crisis here, not only in the city of Modesto, but in other cities around the county. And it's time to deal with that part of the problem. It's a huge problem. And we want to thank Supervisor Withrow. We met with him yesterday. He gave us a lot of information about what the county's been doing, and we intend to meet with each supervisor over time, as well as each city council member, and see how we can work to solve this problem. Thank you.
Thank you, James. All right, my next speaker card is for Ruben. Ruben, good morning. Thank you for being here.
Good morning. Buenos días. If you don't mind, I'm going to say it to Spanish, first of all, for everybody to
Sure.
understand.
Sure.
I'm here to be with Señor Miguel. And what I'm going to say is, necesitamos el reporte que estén en español, que nos den asistencia técnica, poder que sea pública para las casas de bajos ingresos y extensión por menos de 3 semanas. Gracias. 3 semanas para comentarios. And I'm going to say in English to anybody that don't understand. We need a technique assistance to understand the report, the pages, 115 page. And we need a report for the, to put the papers in Spanish, people, they can understand better. And we needed 3 weeks for the comments, for people can make comments about the reports. Plus, we need to include the housing's report, especially in low income. And thank you. My name is Ruben, and thank you for understanding, and I hope you can help us.
Okay. Thank
Thanks.
you, Ruben. All right, our next speaker is John X. Mataka. And he will be followed by Mr. Donoso.
Good morning. I'm John X. Mataka. I'm with the Grayson Neighborhood Council. I'm here today to talk about the Comprehensive Economic Development Strategy of 2023 to 2028. This draft plan needs to be translated into Spanish. The Latino community represents a large part of the community that struggles to make ends meet, that is lacking mobility to get higher paying jobs due to being in primarily the, quote, essential worker status. We are the highest percentage of population without a high school diploma. To have this population, many who speak Spanish only, out of the process is not okay. The public comment period of 30 days needs to start once this report is distributed to the community in Spanish. This plan is at least, it's over 100 pages, and even English speakers have a hard time reading it. I was at the committee meeting of all the cities, the development committee meeting, and even staff there had to admit that they really needed more time to understand it. Outreach to all the 9 cities and the unincorporated areas should take place. This would be an excellent opportunity for our new racial equity officer to be introduced to all the county. The outreach should be in Spanish and English. We also need technical assistance to understand the report to community leaders so that we can better help the public understand what's in that report. And we need more information on the housing issue. There was very limited discussion on the housing issue in that. And I think the main issue with the housing issue is that it doesn't really speak to the fact that this county and the whole area has never met, and the city has never met their requirement for low-income and very low-income housing in over 50 years. So I just have one other comment for Sheriff Dirksey, if he's still here. If he's not, somebody can relay it to him, that I hope all those announcements are going to be, he's going to have one of his Spanish-speaking staff make those public announcements in Spanish and put them on the radio or someplace too, so that the Spanish-speaking community has an opportunity to understand the warning about what's going on with all this flooding. And that's it. Thank you very much for your time.
Thank you, John. Up next, we have Miguel, followed by Evelyn Landros.
Thank you, Mr. Chairman. I was in a meeting with the 27th of this last month in regard to the Stanislaus Economic Development Committee. and the agenda to be approved was a draft in regard to the 23 to 28 fiscal year. But under the public comment, we have 4 issues. One is to please to make the report in Spanish, that way the community can understand that and have more access and have communication, and to be part of the review and the communication access and to able to understand, because it's over 115 pages. Like Mr. Mataka said, very few people, even in that meeting, was people that don't have that report, and at the same time was a draft, and that day want to recommend it to approval, and that's not right. Because you receive that package that day, and you guys want to support and approve that draft. That's not really a professional way to do it. The other one is the issue of the housing. Even the director of mental health and everybody that come to speak is the issue of housing. And yet in that report is not including only statistics and a few information, but not mentioned it's a big issue and big problem in this county. Not only this county, but all the state, but at the same time, this county, and that report, it failed to say that the housing is one of the biggest problems. What is the purpose to bring a good economic in this county or raise the earning process, earning pay, where you can afford to rent? It's over 50%, the people that pay the rent is 50%, and the paycheck every month is 50%. That's economic. That's economic effect in this county, and still in that report, no one to mention that. So that's something wrong with that report. The other one, very few statistics in regard to the demographic. This morning, the doctor to speak in mental health, it never shows the demographic. So how many are Mexican American or Latino that have problem with mental health? How many of the different races have mental health problem? How many white people have? No, you never mentioned that. So that's another part, that keeping every department come here with no demographic report. That's not right, Mr. Chairman and members of this board. And the last part is we need more than 30 days to people receive the report, not only in English but in Spanish, but we need technical assistance. Very few people understand what that report is, very few people. Even members of that committee was confused in asking questions. Even the mayor of the city of Modesto was confused. And 2 or 3 members, you don't understand the report. So something is wrong. Or it's too late to bring the report for that day to do the draft approval, or that report is so complicated that very few people understand. You need to college or to be part of the economic understanding. In the same time, that membership has to change, Mr. Chairman, because it has 4 or 5 members from the community representation, and the majority is upper middle class or professional people. We don't have low-income families. We don't have people that understand or have problems under the third community regard to economics or the affecting the housing or the job, and nobody is there. So that committee has to change. The majority of the members there have own business or be part of the business, even ex-member of the Chamber of Commerce is there. And yet, we don't have no underserved community or people that affect the economic in that committee. That's not right. Thank you, sir.
Thank you, Miguel. Evelyn? Evelyn, good morning.
Hi, good morning. Also here with Don Miguel. I have some things also. I have been attending a lot of meetings lately. Racial equity is definitely there. Diversity is also there. Compared to Riverbank, I could say Riverbank is a really high Mexican population also, but they're also very much nicer than what we are. and they're 20 minutes away. So that's not too big of a difference. The housing has been over 10 years already that I remember when I was younger. It's still rolling over. I'm not sure why nothing on housing is being done. We still need the houses for low-income families. If you are going to build them, don't build a house that's looks like a mansion with no yard. Build some for people who are actually also live here and need help. Single mothers, single fathers, families that are struggling or just having a minimum wage job. Not everybody has a $40 an hour dollar job, and it's hard for people right now. Just paying for rent alone, it's basically a whole check, and then the other check is to survive on. So it's not enough. The paperwork and all the meetings I've been going to lately, I'm not really sure why it's still an issue, but a lot of them don't have translator. Technical support isn't there. So the hearing aids for anybody to be able to translate and all of that is missing. It's gone. Or also the paperwork, it's just not there. The paper for the Comprehensive Economic Development Strategy, it's not in Spanish. So if I were to show it to my mom and say, hey, this is what we have going on right now in Modesto, Stanislaus County, I couldn't even read it, couldn't even understand it, don't know what's going on. We are 70%, I don't know if anybody has seen the population lately here, but it's really high in Mexican Americans, and that needs to change. The paperwork needs to be there. The housing report also, I would like to see it. Let's see what it is, what's planned, since it's been so long. And the BHRS, I do like the new program with mental health. It is a good one. What I don't like is that they can't come out and take people if you wanted them to against their will. So they won't take anybody, and they'll just leave them there. Mexico does it to where if you're not mentally sane, they will take you and they will place you in an establishment that needs to help you with get off drugs or mental health issues that you have. People are taking people to Mexico because they have that there and they don't have that here. That should change also. People who are dangerous to the population or to themselves should be put away for a while or whatever need be, and then let out again. And the roads, I don't know what's going on with the roads. I'm tired of the roads. We have the ugliest roads ever. Out of all of the counties, I could definitely say Modesto won that one. Well, I know we pay taxes. I think it's Measure L we paid into last year, and I want to see that change. I want to go down the road and not hit a pothole. My tires and whatever else has to do with the tires are tired of getting broken every day because I hit a pothole, or getting off the road on the freeway is really hard coming into Modesto. So those are some of the things. Hopefully racial equity and diversity starts changing. It's already an open book. Everybody just needs to start, number 1, 2, and hopefully that flips the tables for you guys. Thank you.
Thank you, Evelyn. And if I could ask Mr. Hayes just to speak on some of our translating services and how we can make that available to our folks.
Yeah, thank you. Happy to do that. I do want to mention that in conducting public meetings, I think the public meetings that's been mentioned here is our EDAC, or Economic Development Action Committee, which includes representatives from cities throughout the county as well as county staff. In conducting public meetings, we typically try, and I can't say for certain that every single one of our notices does this because I want our staff to review that, but we try to make sure that we include in our notices the opportunity to request translation services in advance of the meeting to make sure that we have the appropriate staff there given the language that's being requested. We do have quite a bit of multilingual staff at the county. I think our last count that we reported out on last week was we have over 1,100 county employees that speak different languages, over 21 different languages spoken here in Stanislaus County by our workforce, and specific to Spanish language population, over 1,000 employees that are bilingual English-Spanish that are available to support those kinds of requests. I can't speak to the issue regarding the request to have a report translated into Spanish. I haven't been briefed by staff on what that request was and what the response from the EDAC was when they received that request. I assume the EDAC received that request at the same exact time, but I'll be happy to follow up with staff and the EDAC members themselves who should be providing the direction on what should happen next there. So thank you.
Thank you, Mr. Hayes. All right, is there anyone else in attendance who would like to speak on public comment? Yes, sir. Good morning.
Good morning, Chair Condit, members of the Board of Supervisors, County Council Bowes, and Chief Executive Officer Hayes. Noet Baramo with California Rural Legal Assistance Foundation, and I'm a longtime resident of Modesto and Stanislaus County. So I wanted to come here and make just some comments on some of the discussion that's been presented. And first off, we all know that housing is an issue in this county. And as you look at the 5-year plan that was referenced, it paints a grim picture of housing in this county and the pages that are outlined. So the data is there. And then we hear from the presentation on Mental Health Awareness Week that the lack of affordable housing is critical. And so we also see that there's going to be 2 items on the agenda related to housing, the housing element being one. But also over time, the community has also raised its issue around housing. Last year, in September of 2022, the West Modesto Community Collaborative hosted a housing summit to really raise the voices of the residents and share what they're living through. So as we're looking at community economic development and housing, you can flip them back and forth, but they're all interconnected. And we have to make sure we integrate them. So as we see the 5-year plan that was presented at the Community Economic Development in draft form, we see the 2030 plan, we see the Farm Worker Resource Center we also see the Community Economic Resilience Fund called Thrive, now rebranded. CO Hayes presented there. That all of these are going through processes. They all have their mechanisms, they all have their government structures. But we need to assure that there's access, there's equity, there's diverse representation in all these structures. And as we go forward, this is critical because we all want housing, we all want jobs, but it has to be balanced. And how we do that has to take thought. And we don't want to end up in a situation where they all hit each other, right? We heard the red tape, but when you cut the red tape, you also need a safety net. So we're going to make sure that safety net is there for our vulnerable residents. So I also wanted to share that at that presentation on SURF, UOP presented data, and a couple of those points stuck in my mind is that we're seeing a migration from the Bay Area to this area in these 3 counties, so specifically Stanislaus and San Joaquin County. And these are people that are more educated, higher income, good jobs, and they're going to be competing for housing and jobs in the community that we live in, where it's high Latino, youth, lower educational levels, and so that challenge is going to be there. And just to provide an anecdote on the need of housing, we hear it, $1,200 to $1,500 for 1-room housing in Stanislaus County. I'm not talking about a house. I'm talking about a room in a house. That's a mortgage. So as we look at housing, let's look at the Mortgage Relief Assistance Program, rental assistance, technical assistance, legal assistance. We also look at subsidized housing. And as we see, child care is one of those economic development engines. Where are those child cares going to be? In homes. So we have to be sure that those homes are also adequately protected for the kids that will be there and the people running those businesses. So this cuts across all these different lines in the intersect. So let's assure each other that we will work together, not just from a business standpoint, but a community-centered standpoint, a worker-centered standpoint. Thank you for your time and your consideration.
No, thank you.
Good morning.
In regards to what? No, I'm sorry, Miguel, this is public comment, and you had your phone.
You pushed the interpretation of the report in Spanish.
I'm sorry, Miguel. We will address that another time. I apologize. All right, is there any other members of the public who wish to comment? All right, seeing, Steve, are you, no? Okay. Seeing none, we will close public comment and move on to the consent calendar. This will, again, be a roll call vote since Supervisor Graywall is teleconferencing. And do any members of the board wish to pull any items from consent?
So I just want to comment on B5, but we'll take it with the whole
Okay,
vote.
so B5, okay, and then I do have a comment card from Mr. Donoso regarding item 5D2, so that will be commented on. Okay, and then I will open up to members of the public. Are there any other items that you wish to comment on? Okay, seeing none, we'll bring it back to the board. So you want to start?
So on B5, this is a joining forces with the city of Turlock regarding license plate readers. I know it's taken a little longer than we wanted, but I envision this network of cameras, and I think the sheriff has a pretty good vision countywide. The sheriff's contract cities, Riverbank, Patterson, Houston, Waterford, all have cameras. And so they're joining our contract, 6 different sites, which I think is fantastic. As we look forward, I see synergy both with Public Works. We're doing some things down in Turlock where we're, instead of doing half the road, we're doing the whole road. Contracting like this through the Sheriff's Department that has the master contract saves money for taxpayers. And so, again, I always love highlighting things that save taxpayers money. We should all be on the same contract. This is no different than what the fire departments are doing, but another great indication of us being able to work together for the betterment of the citizens.
Thank you, Vito. All right, and then we do have a comment card for item 5D2. Mr. Donoso, if you'd like to comment on that item.
Thank you, Mr. Chairman. One of the biggest issue is under the cycle 5 and to come into the cycle 6 under the housing element. This county doing very poor job in regard to the very low and low income families. No houses. We continue with the same problem for years, and many times not only the county, but at the same time the cities are behind 2 or 3 years doing the report in regard to the regional allocation of housing and units. And yet, the middle class and upper middle class for home is up. So it makes very difficult and confused to understand. Members of the public working in the foster farm are homeless. Hard to believe. So you work in the foster farm, but at the same time you have to go to the shelter to sleep there because there's no houses. That's economic. If Mr. Hayes refused his staff to bring the Valley, regard to the Valley Vision, the program that you guys approved for $500,000 to do a study and report in regard to housing, 2.5 years, never see the report. And yet, the housing is the biggest issue. So when Mr. Hayes is going to allow that report to continue confusing the people, because the people don't understand what really is the problem because of the county not doing the job it's supposed to do. And the Valley Vision is supposed to do that report. 2.5 years, pay $500,000. And he acting like, I don't know, I don't remember that. So the question is, what we are doing regard to the housing issue? You have employees of people working in foster farm. There's the place of Mr. Victor Chesa. And yet, that poor people have to go to a shelter home to come back the next day to work. That's not right. Thank you, Mr. Chairman.
Thank you, Miguel. All right, do any other members of the public wish to comment on item B5 or 5D2? Okay, seeing none, we'll bring it back to the board for action.
Motion to approve the consent calendar.
Second.
We have a motion to approve consent by Supervisor Chiesa and a second by Supervisor Condit. We will have a roll call vote.
District 1 Supervisor Condit?
Aye.
District 2 Supervisor Chiesa?
Aye.
District 3 Supervisor Withrow?
Aye.
District 4 Supervisor Graywall?
Aye.
And District 5 Chairman Condit?
Aye. Okay, so moving on from consent, we will go to our public hearings portion. And we do have a presentation by Rob Koslevy and Mandeep Dillon, and they will be giving us a presentation regarding fees for the Department of Environmental Resources. Good morning, gentlemen. Thanks for being here.
Good morning. Well, good morning, Chairman Condon, members of the board, CEO Hayes, County Council Bose. My name is Rob Costa. I'm the Director of Environmental Resources. Rob, pull it to you. This morning, I will be presenting to you the department's proposed fees adjustments, along with our Assistant Director, Mandeep Dillon. The recommended changes we will discuss this morning include adjustments to the weighted labor rate, fee adjustments related to the milk and dairy, solid waste, landfill, environmental health, and hazmat. These adjustments are necessary to ensure cost recovery for the programs DR administers. I'm going to hand over the discussion to Mandeep Dillon.
Thank you, Rob. As we're waiting for there it is. Good morning, Chairman, members of the board, CEO Hayes, County Council Bose, and members of the public. I'll start with the proposed change to our weighted labor rate. We are recommending increasing the department weighted labor rate by $9. From $128 an hour to $137 an hour, which is a 7% increase. Also, we're recommending a $4 an hour change in our clerical weighted labor rate, $50 an hour to $54 an hour. These changes are due to inflation in program and staff support costs, as well as in supplies, services, overhead costs, cap charges, and so forth. The proposed rate, however, is still within, it's at the low range of the range when looking at the weighted labor rate for comparable counties. Moving on to our milk and dairy division, they're responsible for inspecting dairy farms and ensuring good milk quality as well as sanitation requirements. Milk and program fees were last amended in 2020. We're proposing an increase of 15% this year due to increasing staff costs and contracted labor costs for analyzing the milk samples. So with this change, this will increase the maximum quarterly fee per dairy from $517.50 to $595. For our solid waste division, solid waste is responsible for issuing permits for waste haulers in the unincorporated county. Now, the small haulers, collect and transport smaller quantities of waste that do not meet the permitting requirements of the franchise of the industrial haulers. Currently, there are 21 small hauler permits issued annually. Since the total revenue generated by this revenue source is relatively small, the last time it was increased was in 1992. This year, however, we are taking the opportunity to right-size this fee category, adjusting it based on Consumer Price Index from 1992 to present. In doing so, the fee then increases as shown on these slides. The annual permit fee will increase from $40 to $84, and the annual truck fee will increase from $25 to $52. This increase will help support the labor costs of the permit processing and vehicle inspections. We do inspect the vehicles on these small haulers, make sure they have all the four wheels intact and such, and from safety perspective, make sure they have tops for the loads and so forth. So that's why this program is in place. Also in the solid waste division, we're proposing to eliminate the annual permit fee for both the franchise and industrial haulers. This fee category is not needed as the franchise and industrial haulers already pay franchise fees on their gross receipts. So, right now we have just 4 franchise hauler permits and 5 industrial hauler permits that we issue annually that only brings in $1,000 annually. So we're proposing to eliminate this fee source to make it more streamlined for our processing. Next, we have the landfill, the Fink Road landfill. We're recommending a 7% increase in the normal refuse disposal fee in order to cover increasing operational cost and capital improvements. This rate will increase, as shown, from $42 to $45 a ton. Normal refuse includes materials such as garbage, paper, lumber, construction debris, and landscaping waste. Now, just to clarify, the proposed adjustment to this rate will not impact disposal fees paid by our franchise haulers. All loads are delivered by the general public via passenger cars, pickup trucks, and small trailers. They're still only starting from $12 a truck, $12 a load. The fee increase will largely impact the industrial haulers and large commercial haulers. Moving on to the ash fee, as per the service agreement with Caventa, the ash tipping fee is adjusted annually based on the consumer price index. Accordingly, the fee will increase by 6% from $32.84 to $34.86 per ton. Before I hand back the presentation to Rob, I just want to thank our team, all the division managers that are present here, Janice Min, who's the assistant director at the landfill, and a special recognition to Stephanie Musso, our staff services coordinator, for doing a lot of work to bring us to this point from start to finish, coordinating the whole thing. So thank you, Stephanie. Now I'm going to hand the presentation back to Rob, who will discuss the proposed changes to our environmental health and hazmat program fees and conclude the presentation.
Well, good morning again. Our largest programs that we have resolve in the environmental health program. So starting with the food program, the Environmental Health Division is proposing to create a new category titled Temporary Food Facilities 1 to 2 application review and permitting. The new fee will be an hour minimum weighted labor rate and is mainly geared toward food vendors setting up at community events. Additionally, changes in the California retail food law have created new guidelines for compact mobile food operations. Therefore, the division is proposing to replace the existing mobile food facility fee categories with a new fee category that will accommodate the new changes in the law. This addition in the law also dictates the reinspection fee, which differs from DER's current fee structure. The new law also permits compact mobile food operations to store food carts in homes under certain conditions. Along with the new fees to verified vending site restrooms for mobile food facilities, the division is proposing a new fee for commissary verification at the weighted labor rate. Also, a fee is being proposed to administer paperwork for out-of-county mobile food vendors. So on that category, if a facility is permitted in, say, Merced County, we would contact Merced County and obtain verification from that jurisdiction. The existing fees related to mobile food operators will be removed and replaced by the updated fees I just went over. And so that is, we are eliminating the mobile food facility with limited food preparation, non-motorized confectionery, additional cottage food operation, menu review and modifications, non-motorized confectionery unit, mobile support unit, and mobile food facility. Now, getting to our cottage food program, we wanted to simplify this and we developed a cottage food operation fee, and EH is proposing to change this cottage food facility annual registration Class A and Class B from a fixed fee weighted labor rate Now, for the body art program, the division proposes to increase all fixed fee categories by 10%. Additionally, the division proposes to change several fee categories from fixed fees to a weighted labor rate-based fee. We have listed those on the slide. And getting on to recreational health, environmental health is proposing to increase all fixed fee categories by 10% as shown. And on the well construction program, the division is proposing to remove all fees associated with dry wells. Dry wells are not necessarily a condition of a drought. It's a condition of creating a shallow well which would be utilized for storm runoff. And the California code does not provide any parameters for environmental health to do those permitting. So if we were to permit those, we would be using discretion, and we do not want to do that. We want to stay out of that realm. And for the environmental health water program, the division is proposing to increase all fixed fee categories by 10%. And with the new revised total coliform rule, the division proposes to add a new fee category titled RTCR Level 2 Assessment, and that's going to be at a 4-hour weighted labor rate. And for our land use program, this is the one-stop shop that we have up in the planning and building. The environmental division is proposing to change the land use minor and major fees from a fixed fee category to a weighted labor rate. And the breakdown is for the minor is 2 hours, and the major would be 5 hours. And lastly, we have a few proposed changes in our hazardous materials division, which is responsible for inspecting approximately 2,500 businesses for hazardous materials and hazardous waste. We are proposing an increase of 15% in the fees of the 3 programs listed on the slide. The increase is needed to primarily due to regulatory changes requiring additional staff hours in the programs, as well as training hours, supervision, record keeping, and reporting requirements. For instance, a gas station typically takes at least 4 hours to inspect annually, and that's not including the preparation for that gas station. Then we have electronic reporting that's brought into that, where we put all the violations and the analysis of that inspection report. And at the fee hearing last year, we informed the board that the 15% increase will be needed for a few years to fully eliminate the funding deficits in this program. The increase this year is consistent with our multi-year fee strategy, and similar increases are possible in the next year. Now, the department conducted 2 public stakeholder meetings in March to provide information to the public regarding these proposed fee changes and receive input from the public. Overall, stakeholder feedback from the 2 workshops was favorable in the proposed changes in fees. Public notices announcing the March workshops were published in the Modesto Bee on March 5th and again on March 12th. The proposed fee changes were also posted on the department's website. Staff also conducted fee comparisons, the results of which are included as an attachment to the agenda. The comparison shows DER's proposed fees to be in line with the other counties' comparable demographics. In conclusion, we have this recommendation. Introduce and waive the first reading of an ordinance to establish new and amend or eliminate existing fees for the Department of Environmental Resources, and if approved, fees will be effective June 22nd, 2023, with the exception of the landfill. And those fees would become effective July 1st, 2023. And if there's any questions.
Are there any board members having questions or comments? I guess I do, Robert, just a couple questions and maybe a comment or two. But I guess how do we ensure that this doesn't become an annual 10, 15% increase? I mean, do we have a strategic plan or at least a thought on for folks who are struggling financially? I mean, how do you, because fees aren't just going up in your department. They're going up across the board in every department. And so eventually people are going to be stretched thin. And I guess how do we keep from making this an annual, or like for instance, that one fee hasn't been raised since 1992. Well, how can we get to that scenario where these fees do become fewer and farther, and that there is a wider gap between the time that we do have to raise them?
Sure. Well, one thing that we're going to need to look at is the amount of self-sufficiency that we have from the board of how much we should be funding ourselves, you know, and how much is going to be taken from the general fund. You know, in Tuolumne, my prior jurisdiction, it was 80%. We wanted to be 80% fee funded, and then 20% would be coming from other sources, and that's something that we need to really look at. You know, this year has been challenging for us. I guess when you really look at it from a big picture, we've been dealt the proverbial hand of a bouquet of lemons. Mm-hmm. We had 100% turnover in our accounting division, and we also had a vacancy in our business manager position. And if it wasn't for this man right here, who's we're lucky enough to have an assistant director that's a certified public accountant, we would have been in a world of hurt. And that's what we're doing, is we're taking all that data now that he's been able to compile and really see what we can do as a department and a county to truly show what each cost is. And that's where you're seeing a lot of the weighted labor rate costs. So if we bill somebody and it's too little, we can also go back and say, you didn't meet what was expected, but vice versa. If we built somebody for 5 hours and we only spent 3 hours in the program, we're gonna do what's right and refund that money back.
Okay. All right. Well, I look forward to entertaining those solutions moving forward and potentially widening that gap of timeline of when we have to raise these fees. So again, I appreciate your presentation. Terry, do you have a comment before we open to public?
Yeah, just real quick.
Go ahead,
first,
Terry.
if I could, just first, I want to thank you for recognizing the value of CPAs, Rob. That was very nice of you.
Oh, yeah, we got me.
Very good when I always bring that up. Then I just want to say, this is always like the no fun meeting every year whenever we have to do this and go through. We've got a list of departments and fees that we're going to have to raise, and I know it's not something any of us want to do, but I understand, and that where we are is we have to just cover our cost. We're not here to make a profit. We have to cover our cost. And I think if we end up, and that's decisions this board has made if we ever wanted to change the way that we're going to do this, but if we end up taking more from general fund, then we have other programs that money will come from in order to subsidize those fees. And those fees are really on the individuals, for the most part, who are specifically involved in these areas. And they're burdened with these fees. And again, it's just covering our costs of doing business. And so it's never fun, not something we enjoy doing, but understand, I appreciate that we actually are coming back more often, and instead of having those long gaps where we haven't done anything for years, and then all of a sudden we've got this giant increase, again, justified, inflation, CPI adjusted, that's all fine. But it sure is a lot more painful when we do it annually and to kind of take a look at it that way versus waiting and making it a giant increase each year. So anyway, not a fun position to be in, to have to do this. None of us enjoy it. But
thank you, Terry, for the professional courtesy. I'm just trying to figure out what I want to do when I grow up.
You want to come, when you're done with environment, you come work at my office, Mandeep, is what we're going to do.
Thank you.
Supervisor Graywall, do you have any comments? I don't want to neglect you if you do have any comments on this matter.
No, thank you so much.
Okay, thank you. All right, and I do have to open it up for our public hearing portion, so we'll open up to the public. Any members of the public who wish to comment on this item, please come to the podium.
Thank you, Mr. Chairman. If the agriculture business is over $3 billion, but the essential workers, especially in the dairy, 95% have no documentation and work in the dairy. But at the same time, the port and housing and health services are not there. So you're talking about billions of dollars, and yet poor pay, the trailer house where the guys live sometimes in the houses, poor condition for their workers. So the issue is what the environmental agency is doing to do the inspection and report back to the committee in regard to that issue. Number one, why is 95% of the workers not have documentation? Of course, you want to say, well, it's a matter of economics, because you guys don't ask for too much money, and you guys no need to have a good housing to live. At the same time, when you guys are sick, the dairy don't pay nothing, giving aspirin. When it happened to the COVID-19, giving aspirin. Go home, go to your room. So we're talking about $3 billion annually. At the same time, the essential workers, a very poor treatment and doing nothing. So the county council with the commission has to ask the question, why that problem exists, and not only in the dairy, but through the whole valley. Like Mr. Victor Chesa have a ranch, and I know he's good in that, one of the few ranchers in this county that's very good for his workers, because he understands, even he speaks Spanish. But a few dairies don't do that. Even the people that want to say, well, give me the names of the dairy, that way we can inspect. I'm not going to be foolish to give the name, because I know the next afternoon he's going to be fired, that poor people. And yet, nobody have a place to go in to complain, because he's afraid to do the complaint, because afraid to send it back to Mexico, whatever, but at the same time is afraid because he feels he don't have the rights as a human beings to live in quality place to live and raise his family. That's a big question for the commissioner. And yet, asking for a few more money, well, like Mr. Whitro said, that's needed to keep doing the job. But in the report, never mentioned how the workers in this county for the agriculture, this $3 billion a year, is doing. No report, no statistic, no demographic. That's a question to us. Thank you, sir.
Thank you, Miguel. Is any other members of the public wish to comment? Evelyn?
I have to agree on that. I do believe the whole thing right here is backwards. I don't agree with the increases in garbage. They're just going to be way more expensive for everybody. They already went up this year, and they shouldn't go up every year. It's not essential to do so. Where I do see the essence of where we should be looking at is the pollutions that's going into the food. So the water pollution, we have a lot of water pipes here in the county that need to be fixed. Also the air pollution, we have one of the worst air pollutions. So all the food that's growing here, it's not necessarily good for you. If you try to look at that and see what you're actually eating, do the testing, that's where you guys should be looking at. You should be looking at our water and our air. Change the water and the air. Definitely the housing. If there is going to be any money going to anybody, it should be going to the people who's working on the fields. getting health care, getting what they should be getting, being appreciated. It is an essential job. They do put food on people's tables. That's a whole circle in its own, and it's there. It's not going to go anywhere. The treatment, the health, the mental health, the money that they should be receiving, and the housing, that's all there.
Thank you, Evelyn. Martha? Martha, good morning.
Good morning. I also don't agree that the garbage should go up because I don't even use the 3 garbage. I don't. I live by myself, and I have to pay for the 3 garbage, and now it's going up. I don't have enough money to support myself and to pay my rent and to pay my bills and put gas in the car, and when my car breaks down, I have to walk. So I go, I don't know. I think so this is just money talks. It's just going up. But what happened with the people who works? The people, because I used to work also in the fields. What happened with all those people? Nobody thinks about them? The people that they're 70 years old, that they don't get enough money from the government? The people that they're sick? The people that they don't have no arms? They have to pay the same thing. They have to pay that. We're paying the same thing that anybody who has a nice house, a nice yard, we're paying the same thing. Poor or rich, we're paying the same thing. But why? I'm tired about this. I'm really tired. Thank you.
Thank you, Martha. Any other members of the public wish to comment? Okay, we will close our public comment period and bring it back to the board.
I will make a motion to approve all staff recommendations.
Second.
Okay, we have a motion by Supervisor Withrow and a second by Supervisor Condit, and we will have a roll call vote.
District 1 Supervisor Condit?
Aye.
District 2 Supervisor Chiesa?
Aye.
District 3 Supervisor Withrow?
Aye.
District 4 Supervisor Graywall?
Aye.
District 5 Chairman Condit?
Aye. Okay. Moving on to 6.2, we have a PowerPoint presentation by Sam Groves, and it is in regards to the ordinance amending existing fees and planning services.
Good morning, Chairman Condit, members of the board, Mr. Hayes, and Mr. Bose. I'm Angela Freitas, the county's planning director. And with me this morning to present the item is the department's deputy director of finance and operations, Sam Groves. While Sam's getting the slides up, I'll just kind of say planning services covered under the department's fee schedule include a variety of different application types, including land use entitlements, which range from general plan amendments to use permits to staff approval permits, lot line adjustments, land divisions. We have the Williamson Act administration, and then we also do review of alcohol beverage control license, business licenses, and building permits. The department collects both flat fees and deposit-based fees with the goal of recovering 100% of the application-related costs. The department is proposing a 3% increase for all flat rate fees. The increase amount is based on weighted labor rate increases. The proposed increase translates to permit fee increases ranging from $2 to $132 per application. Some of our more common application types, parcel maps with Williamson Act would go up $109, agricultural use permits would go up $112, and then our most expensive increase would be our use permit requiring board approval, which would go up to $132. There is no increase to deposit-based fees being proposed, and while there is no new fee type that is being proposed this year, we are proposing a modification to the development agreement, which has been made since the fee schedule was originally released to the public in order to provide a clarification relating to development agreements, including not only new applications but also amendments and renewals. Development agreements are subject to public hearings by both the Planning Commission and the Board of Supervisors. They are an actual cost deposit-based fee, and while the county has historically not utilized many development agreements, they are currently a major component of the county's cannabis program, and in anticipation that in the next 2 years, there's going to be maybe approximately 19 development agreements that are going to require renewal. We are asking for the clarification that development agreement fees be both for new, amended, and renewal applications. In addition to services with fees, the department will continue to offer pre-development meetings and to have planners on call for general inquiries at no cost. The goal in offering these services is to help facilitate the development process through early identification of potential issues and direction on the process and/or application needed for development to occur. Notification of the proposed fee amendments were provided to regular representatives and applicants seeking planning services, to the Stanislaus County Farm Bureau, and to the California Building Industry Association. And to date, we have heard no concerns raised with regards to the fee. Staff is recommending that the Board of Supervisors conduct a public hearing to introduce and waive the first reading of an ordinance to amend existing fees for planning services, and if approved, the proposed fees will become effective on July 22nd of this year. With that, we're available to answer any questions the board may have.
All right, any questions or comments from board members? Okay. We will open it up to the public for our public hearing. So any members of the public wish to comment on this item? Okay, seeing none, we will close the public comment portion and return to the board.
Motion to approve.
Second.
Okay, we have a motion by Supervisor Buck Condit and a second by Supervisor Chiesa, and we will do a roll call vote.
District 1 Supervisor Condit?
Aye.
District 2 Supervisor Chiesa?
Aye.
District 3 Supervisor Withrow?
Aye.
District 4 Supervisor Graywall?
Aye.
And District 5 Chairman Condit.
Aye. Okay.
Thank you.
Thank you. Okay, moving on, we have a PowerPoint presentation by David Lehman and Frederick Clark, and this is in accordance to amend existing fees for the Department of Public Works. Mr. Lehman, Mr. Clark, good morning.
Good morning. Good morning. Good morning, Chair Condit, Board of Supervisors, CEO Hayes, and Council Bose. Frederick Clark, Deputy Director at the time of Development Services. He's now in Roads and Operations, but this is his study. I'll let him go through the PowerPoint and explain what we're up to.
Okay. Last year, we went through a fee update, and it was an engineering news record percentage update. In other words, we accepted the fee schedule we had, and we just increased by the engineering news record. It was about 8 1/3%. Our existing fees, we know, are not covering our costs. So in checking, there had never been, to our knowledge, as long as either one of us have been here, an independent third-party industry standard review of the public works fees. We engaged a consultant to conduct that study, and based on their results, essentially 17 of our fees increased and 8 of our fees decreased. The third-party review showed that we needed better timekeeping to allocate costs to the particular types of fees. There was a definite acknowledgement that we lose money on certain types of fees in order to promote safety and construction codes. Because if we actually charged what we were supposed to charge, we get a lot of people who avoid the fee process, avoid the permitting process. And because of that, then we're chasing them. We're trying to find them in the field. So by purposely taking the loss at the front end on the applications, we're able to get far more permits being pulled. Essentially, that program costs about $106,000 a year. There's a loss of about $106,000. There's also an acknowledgement that we take a loss on the transportation permits. There's not anything we can do about that. That's a state law. They limit how much your fees can be. The program itself is you want to encourage people to pull permits, transportation permits for non-standard loads because it protects your bridge systems. If you get something that's too wide, knocks your rails off, too heavy, can actually crush your bridge. So you definitely want to be part of the process directing where those non-standard loads go on the county network. The county surveyor, we have a brand new county surveyor this last year. He wanted to hold the fees in abeyance the way they are right now and take the year to study the system and the processes to find out if there are ways that he can cut costs, keep costs down. And so effectively we have done that with very few exceptions in the county surveyor's fees. Giving that year, next year you should see some kind of a report come out of that adjusts a proper location of those fees. Regarding the amended fees themselves, they're all listed here. Like I said, 17 go up and 8 go down. However, from a statistical point of view, there's a backstory on that. For example, in our excavation permits, we're doing somewhere around 500 plus permits a year. Statistically, that's a good number to look at the body and say, are the fees too high or too low? The same applies to our construction permits. We're doing somewhere in the neighborhood of 100 permits per year per type. And it gives you a good number to draw on. However, when we look at the fees that are collected by planning, the stuff we do with them, a lot of times we've only done 1 or 2 projects a year with them. And so that's, from a statistical point of view, not the best for analysis, but it's the only thing we have. And incidentally, each of the fees collected by planning are proposed to be raised. Our permit process, we went through the analysis. We send out to the local engineers and architects and attorneys which work in the land development field. This year we received no comments. Last year we received 1 comment back and they wanted to do away with all fees, which wasn't practical, but no comments this year. We also do the comparisons with the similar counties. That in itself, it'll give you a general picture, but not a whole picture, and the reason is because we all use different types of fee scenarios. Some charge a flat rate, some charge by the hour, and they charge at different definitions of what the fees represent. So though it is a general comparison, it doesn't really show you a lot of information. So our recommendation here is to conduct the public hearing and introduce and waive the first reading of the ordinance and amend the existing fees for the Public Works Department as submitted.
Thank you.
All right,
Any questions?
Did you guys get a new printer? Color printer? These are impressive, these sheets.
Well, I think the big message here for us in Public Works this year really is that we took the time to get that third-party consultant involved so that the permits themselves, the basis of the permits, is industry standard. And so what you're likely to see next year, or maybe even the year after that, is an adjustment to account for labor changes, because we don't buy materials. We're not putting out a product like that. Labor is the big issue for us, and labor is a known quantity for the county. So realistically, That's the kind of adjustment you should be seeing, at least for a few years going forward. Periodically, you should bring in a third-party consultant to review your fees.
Okay. Bob? Thank you, Chairman. Frederick, Dave, thanks for your presentation. I just have one question. The historical site review, 80 to 800?
Right.
That's not a typo?
They're all over the place. We don't do many of them, and the ones that we have done have been complicated. Let's see, is it a typo there? Let me look, I got it open.
I guess another question would be, how many of those do we do?
Two, and it wasn't even per year. How many, was it several years, wasn't it?
No, it was two
Two in
last
1
year,
year.
and
Yeah.
they didn't complete the process. So we
Right.
put a lot into it, but it
Right.
never went to fruition.
So I think when we come back in a couple years to talk to the planning director, Angela Freitas, I think what we'll propose is, a flat fee plus time and materials. But like I said, we don't do too many of these. We don't have, it's LaGrange and Nice Ferry, more or less, those two towns that we do these reviews in.
And is it the big jump to 800, is it because it requires so much time?
It does. In fact, when you work in Knights Ferry, because of the historical designation, for example, the permit we worked on was downtown, and the big issue was parking. The business that we were working with did not have on-site parking, per se, and so they wanted to park on the streets. Well, there are residents on the streets, and the complaints were, well, you're parking in front of my driveway, or in front of my business, and issues that normally
Familiar with
don't-
those complaints, yeah.
Yeah.
Thank you.
Okay. Supervisor Graywall, any comments or questions?
Not at this time, thank you.
All right, thank you. All right, we will open public hearing to the public. So any members of the public wish to comment on this item? Okay, seeing none, we will close the public hearing portion and bring it back to the board for action.
Motion to approve.
Second.
Okay, we have a motion by Supervisor Chiesa and a second by Supervisor Condit, and we will have a roll call vote.
District 1 Supervisor Condit?
Aye.
District 2 Supervisor Chiesa?
Aye.
District 3 Supervisor Withrow?
Aye.
And District 4 Supervisor Graywall?
Aye.
And District 5 Chairman Condit?
Aye. Okay.
Thank you very much.
Thank you, Mr. Lehman. Thank you, Mr. Clark.
Thanks, guys.
All right, and then our next presentation will be by Angela Freitas, and it'll be a PowerPoint presentation regarding our urban development entitlement programs, annual action plan for the U.S. Department of Housing. Angela, thank you.
Good morning, Chairman Condit, members of the board. I'm Angela Freitas, the county's planning director. With me is our deputy director of community services, community development, Anna San Nicholas. She is going to be taking us through the presentation for this upcoming fiscal year's annual action plan and a amendment to the citizen participation plan. So, Anna.
Hey, good morning, Chairman, board members, CEO Hayes, County Council. Today you have the fourth installment of the 5-year plan for HUD entitlement funding. So for fiscal year 2023, we have our funding plan for the Stanislaus Urban County, which is 7 of the 9 cities, and our Stanislaus Home Consortia, which is brand new, which will include 8 of the 9 cities. So the only real difference is that it will include City of Turlock, and not Modesto. And because Big Happy Family couldn't fit in terms of a description, we decided Stanislaus Cooperative can be our term when these documents are about all our involved jurisdictions. So for the development of this annual action plan, you have community meetings that we've had with the Continuum of Care, Turlock Collaborative. Each city had their own community meetings as well as city council meetings to address and receive feedback on the plan. Stakeholder outreach was conducted. And again, we spoke with city councils and their city and the city member jurisdiction staff. And we also met on March 13 with the county's Community Development Committee to discuss the plan. So for the upcoming fiscal year, 2023, starting July 1st, we have an allotment of $2.3 million in CDBG coming into the county, ESG, $208,000, and $1.7 million for home. So both CDBG and home are receiving a slight decrease and a slight increase for ESG. So community development block grants help us address infrastructure, health and safety issues, economic development, and also we take 10% off for public services. ESG is more focused on homeless prevention and homeless services, while home focuses on housing, rehab, home buyer assistance, and land acquisition. So the breakdown for the urban county, all the cities except Turlock and Modesto, is, again, the 2.3. So we have it broken down into project funding by formula for each city, anywhere from 150 to 250,000. Each city gets their own allotment of admin funds to address the operations of the program or project. County also sets aside 10%, again, for public services, and also funds a fair housing program. It's being recommended for the urban county. ESG, we set aside what HUD allows us, 7.5%, and the rest is put out in a NOFA for public services. For the next upcoming fiscal year, county will continue with its allocation to invest money in the West Modesto Sewer Infrastructure Project that we partner with Public Works. And then our Fair Housing Services Program, $25,000 allocated for that. And each city has continued to invest in their existing projects for health and safety issues, infrastructure. So the only city that has a brand new project coming up is the city of Riverbank, which has proposed a Riverside High Street water line installation project to start investing their funding for that. For 2023, each of the cities participated in a grant review process, county representative, and as well as a representative from the Continuum of Care participated in reviewing about 18 applications for ESG, Community Development Block Grant Public Services, and 6 for ESG, and we'll go over the proposed funding recommendations. Before you have is the scoring criteria and the breakdown of what they were evaluated on. So the application process started in December. The grant review panel reviewed them in February, and we bring before you being able to fund 9 of the 8 applications. $25,000 was what their original ask. We were able to slightly fund them a little bit higher based on the recommendation from the grant review panel. Anything less than $10,000 really isn't worth the documentation for both the service provider as well as staff. So that's why we divvied up amongst the awarded applicants the additional funding. And for ESG, we had 6 applications. By HUD regulations, we have to fund rapid rehousing, rental assistance, homeless prevention. So we take that off the top. So we were able to fund community housing and shelter services that applied and scored high enough for that eligible activity. And then the We Care program came out on as number 1 for the shelter. So we were able to fund those 2 for the next upcoming year. HUD does propose 60% cap on shelter assistance and a minimum required of 40% for rental assistance. For the home allocations, we have about $1.7 million coming into our home consortia, and so the cities each get their own allocation. Starting July 1st, if they do not have a project to invest that funding in, it will go into an affordable housing consortium program where we can do a NOFA and look at what projects are feasible countywide. So they're not able to use their funding, it will pool to approximately, 1.5 million. But we do by law have to set aside funding for a community housing development organization, so that is set aside, as well as admin for the county. Now, the proposed programs as a consortium that they're interested in doing is again, a consortium affordable housing program, housing rehab program, and our set aside funding for any organization developer. Now, also today is our citizen participation plan amendment. It is to include language to talk about the county's lead role as a new lead entity for the home consortium, and also update the HUD description of the affirmatively furthering fair housing assessment, which was our fair housing analysis. Now, our public comments received between the release on March 31st to May 1st. We only received one comment via email from Mr. Miguel Donoso regarding questioning our limited English proficiency efforts. And we did respond to him that we make every accommodation as possible for our programs, and we see to it in their agreements. If we fund a service provider or a city, we add that language to either the bid documents for receiving bids for projects or when we award funding to a service provider. So, and as well as in meetings, we try and make accommodations as much as possible. Now, each city had their own opportunity to receive public comment. The city that received the most, or actually any this year, was the city of Ceres. They did receive, city staff received direction from their council to go out and try and get more community outreach. So they moved their annual action plan approval to April 24th. Between that, they had a meeting on April 20th in the Ceres Community Center, where they did receive feedback from the community. Community members and council members were asking for more affordable housing opportunities, assistance for homeowners, veterans, seniors, rehab assistance with ADUs, and sidewalks. Now, today we have the staff recommendations before you to, once the closure of the public review period, to conduct the public hearing, approval of a filing of a CEQA notice of exemption for the annual action plan, fiscal year approval for the 23-24 annual action plan, citizen participation plan amendment approval, and authorization for the planning director to sign HUD program certifications, authorize the chief executive officer to sign CDBG subrecipient agreements from HUD, authorize the planning director to sign program certifications from HUD, and authorize the CEO to sign CDBG and home agreements between each home consortium member and each urban county member city. Authorizations also is for the planning director to sign any related HUD agreements, contracts, or documentation needed for implementation of the programs identified in the annual action plan, and to authorize any feedback received to be incorporated into the HUD document. And also finally, to submit to HUD the final documents. Any questions?
Do any members of the board have any questions or comments?
Yeah.
Vito, go ahead.
Thank you very much, Mr. Chair. The set-aside, the CHDO set-aside, does that accumulate, or is every year that money expended, and what could it be used for?
We can only accumulate it for a few years, and then we hit timeliness. So we can, I believe, only accumulate up to 2, offer it up, and then we can divvy it up amongst who needs it for a project.
What did you say what it could be used for? What
Oh,
specifically?
it can be, well, this, as a CHODO money, it can be used for any developer that has a project within the area and needs that additional money as leverage.
Low-income housing
Yeah.
project, and this is a funding source, and then it doesn't preclude a city or the county from utilizing some of their money on a project?
Correct.
That could be used with that set-aside also?
So new construction or land acquisition and construction, rehab.
So the money, once again, is very thankful. I mean, we look for the feeding programs and the money can accomplish something. The housing money, it's essentially the best thing we can do is all the cities in the county go together and do a project and then next year do another project somewhere else. Because there's just not enough. And what leads me to my editorial comment at the moment, Supervisor Withrow and I are on the General Plan Update Committee, and we've been meeting, trying to find in the unincorporated area. So we're responsible. We talked about RENA, someone had brought up the Regional Housing Needs Assessment, and how difficult the process has become for the county, partially because of Measure E, which doesn't allow the land to be rezoned for housing without a vote of the people. And the intent of that was to force houses into cities who have sewer and water, and it absolutely makes sense. And we all agree, but we continue to get RENA numbers that seem to exceed our ability. So we're literally looking on GIS maps and looking for parcels, infill projects in Denair and Hickman and Crow's Landing and all the unincorporated towns. But it's very difficult because some of them are limited on their sewer and or water capacity. We have water quality issues. I know Evelyn had brought that up. So it is going to get a lot harder for the county, and I'm not sure, we're trying to come up with strategies on what that might look like, but it's just not an easy deal. And so I think, again, once we determine we can cobble money together, and if we can build something inside a city and move the money around so that it all doesn't end up in Modesto or Turlock or Patterson, that everyone has the opportunity to build some of that housing, I think we'll be better served. So thank you for your presentation.
All right. So no other questions or comments. I will open up the public hearing. So any members of the public, I do have a comment card from Mr. Donoso. Mr. Donoso, if you want to start for us. And yes, sir. Anyone else who would like to comment after, please prepare to do so.
Mr. Vito, you're right. It's perfect to 1 year city to that, another city that, even the county. So it's perfect idea. I don't know why. Maybe in the report of the Valley go to do that, but I don't think so. It took 2.5 years still not report that. But that's a good concept. Another cities in county do that, really. I was part of the Santa Clara County CDBG funds, and each city is part of the county, underserved county area, we put money to do housing, and that was excellent. Every year somebody presents his report. Mr. Chairman, under page 4 to 5, I have a question that is using money from ARPA and money from HUD, but at the same time, under the public work, it said that maybe we're going to bring a proposal, request proposal from state water to hook the different areas, especially the area of Mr. Withrow. They're failing to do that because of the lack of funding. So under the public work, he said that maybe we're going to receive funds from that to finish the rest of the proposals of the program. And not there. He never mentioned under the public work idea is you're going to continue to hook more for the houses in different, they don't have the hookup for the water system, but at the same time, the public works say maybe we're going to apply, or we apply, but we still not receive the funds. So what it is, or you have the fund, or you don't have the funds. But maybe, and that's not right, Mr. Chairman, and members of the board. The other one is, we still have the lack of the information for the public in regard to giving that information to understand the so-called public comment under that. And very few do that. And I don't blame the department or the planning department, because I see many times I go to that request for public participation or citizen participation. It's only myself and the 2 members of the planning department sit down in there. So it's has to be a better way to reach the community. We have to involve the community more. Number one, all the reporter courses in English. Second, we need to have more reaching of the citizen and to have more understanding what the citizen need. But in regard to the public work, asking for the state water board to help with the funds and still not having that for many years. It's supposed to be done 3 or 4 years ago. In Mr. Guido area, in all the area that we doing that is lacking of that. So my question is, Mr. Guido, did you talk to the public health department? Did you talk to the director to fix that? I bet you did. But did he listen to you? I don't think so. I don't think so. Because everything had to go through Mr. Hayes. And Mr. Hayes, don't worry, you're going to forget next month. Don't worry about Mr. Guido. And you're an accountant, so your mind has to be very sharp, right?
So Miguel, just so you'll know, if I could,
Thank you,
Chair,
sir.
just really quick. We actually had a conversation last week, I think it was, with Mr. Lehman and Angela Freitas about that subject, and we think we have rectified it, and it's moving forward. And then also, again, and it wasn't something that I had to get Mr. Hayes' permission to do.
See,
And
you had to ask him, you're right.
And then also, we, as far as the public, making them aware, we actually went out, and CRLA, no, he just left, I think, but we went out and walked and knocked on doors, because part of the
Yes, I remember that. I remember that you did that.
No, this was out on Spencer Marshall.
Spencer Marshall, yeah. I
Yeah,
remember
we went
that.
out there and knocked on doors to get the public to, because I think we needed to get 70% to agree that they would be willing to hook up.
Right.
And then we would find the funding to do that. So we went out, a group of us, and knocked on doors and got to the 70%, got people to agree to, because it's great, we say, yeah, you're gonna get sewer and water, and get off your septic system and get off your well, that's great, but then they have to start to pay for it, when we do that. So there's that balance that people are hesitant to do. Yeah, my septic system is fine, or my well's working great, I don't need to go incur this cost. But we were able to get them to do that, and the funding will be coming. We just had, like I said, a conversation about it last week to figure out how to get this moving forward and get that state money to help pay for the hookup. Then there is some hesitation from what I understand, of the county workers to go onto private property and actually do that was part of the hesitation, of the liability involved. And that's what we're always up against, it seems like, issues with legal, and we're going to get sued if we go onto somebody's property and we start hooking up, doing these hookups ourselves, and something goes south. And then, so anyway, that was part of what we were kind of up against to get this. But we think we found a path forward, and we're going to make progress on this. But
Yeah,
thank
but
you for bringing it up.
Thank you, sir. But you really have a letter of the intent for the public work to apply for the funds to the state? Or he still, let me think about it?
No, there's no thinking about it. We're working on it. We're going to get it done.
Yeah, but in the report, you never mentioned that. So I think it's part of when you work in the back of with the public directors, in the same time, is not reporting to the community that he already did the application to the state and it's in the work. But at the same time, the state sent a letter to the public director, say, yes, don't worry, in the next 2 or 3 years, we're going to give you a fund to continue your project. I don't think so. Thank you, sir.
Thank you, Miguel. All right. Any other members of the public wish to comment on this item? Evelyn?
I don't know if I saw the information correctly, but I saw that Modesto and another town is not included in Stanislaus County and everything that they did. I'm not sure if that has something to do with you guys that you're not doing, that we need to be on there, but I feel like it's se les durmió el gallo. Your rooster fell asleep. What is not being done because it needs to be done, and Modesto is one of actually the biggest ones out of all of them, I want to say, that needs to be fixed. They're all pretty nice compared to here. I went to Robertson Road the other day. You go to one side of the street and it's nice. You go on the other side, which is county, and it's just, wow, I cannot believe it. People are living like that. And Why is it that that's going on in Modesto? We have the funds, everything is there. Wake up the rooster. Thank you.
Thank you, Evelyn.
If I may,
Sure,
City of
Angela.
Modesto is its own HUD entitlement agency, so it receives its own Community Development Block Grant, Emergency Solution Grant, and home funds directly from the federal government. And so they do get funds, they just are a separate entitlement entity. The county, along with the other 8 jurisdictions, come in for home funds, and then City of Turlock has its own home funds, or had its own it has its own CDBG funds, so they are then part of us for home. The other 7 cities get all their CDBG tied to the county. So all 10 jurisdictions are covered. We're just separate and different entitlement jurisdictions when it comes to City of Modesto.
Thank you for your clarification, Angela. Any other members of the public wish to comment on this item? Okay, we will close the public hearing portion and bring it back to the board. I do want to mention before we take action, I did notice that Host House and Naomi's House in Patterson did not receive the CBG funds. Of course, that's going to be vital to them and their continuation and all the great work they're doing for our homeless population on the west side, and I know they've made efforts to expand into Riverbank, so I do think they're a critical partner, and would hope that we could explore other options and avenues for them moving forward. Would hate for them to close their doors and kind of end the great progress that they've done. So I do want to mention that before we move forward, but I will entertain action from the board.
If I could just comment really quickly too here at the end. I very much appreciate, and I think Evelyn left, but I wanted her to know that the reason that the small cities go in a consortium is the cost of application. If to receive $100,000, it would cost them more in time and effort. So when we consolidate, again, for the taxpayer, we're trying to do the best thing for the taxpayer. Everyone can accomplish more. There's more money to be had for each jurisdiction. Whereas Modesto's large enough, they receive enough money to do this on their own. And then I don't want the public to walk away thinking that we were just talking about water. Not enough. We always need to do better, and we say that openly. But Modesto potentially serving Riverdale Tract. I know that in Keys they served the south on Barnhart, a low-income area with water. Turlock is going all the way to the Ford dealership. To pick up water coming north on Golden State. We put a pipe across the bridge, the brand new Hickman Waterford Bridge. Both sewer and water line is in the bridge, hasn't been hooked up because we still need, but Hickman has issues with water pressure and water availability. So the potential is there. Houston has been incentivized through a state grant to provide water out to some housing on Whitmore Avenue, and we're trying to come to an agreement so they can serve water to another mobile home park by our old landfill. So there's progress. I know it's not at the pace that anyone wants to see, but we have water quality issues everywhere. Ceres serves mobile home park right off of Central, and I think they did Monterey Park.
We have Monterey Track Park. Yeah.
So there's good things happening around here. It's just not the speed that people want to see, but I appreciate the collaboration between the cities and the county.
All right, I will entertain a motion.
Motion to approve staff recommendations.
I'll second that.
We have a motion by Supervisor Condit, a second by Supervisor Withrow, and we'll do a roll call vote.
District 1 Supervisor Condit.
Aye.
District 2 Supervisor Chiesa.
Aye.
District 3 Supervisor Withrow.
Aye.
District 4 Supervisor Graywall.
Aye.
And District 5 Chairman Condit.
Aye. Okay.
Thank you.
Passes unanimously. Thank you very much.
Thank you,
All
guys.
right, moving on to our discussion items. We have a 7-1, which will have a presentation by Kashmir Gill regarding a rehire as required by the Public Employees Pension Reform Act of 2013. Ms. Gill, how are you doing today?
Fine, thank you.
Good.
Good morning.
Good morning.
Kashmir Gill, County Auditor Controller, and I'm here this morning to request the rehire of Ms. Tina Bonstad prior to the 180-day sit-out period. The payroll division of the Auditor Controller's Department is experiencing staff deficiencies. Tina's assistance is requested to meet the highly critical function of the payroll processing. Tina retired on March 21st of this year after 26 years of county service. The last 5 years, Tina worked as the CEO HR Division Operations Manager. She oversaw the processes involving employee benefits. One of Tina's main responsibilities was to coordinate the electronic workflow between employee benefits and payroll division. Tina is familiar with the Payroll PeopleSoft application and regularly collaborates with the payroll technical and functional staff to ensure that personnel-related updates are accurately reflected in the payroll records. Currently, 4 of the 10 allocated positions in payroll division are unfilled. That's a 40% vacancy rate. Recruitment challenges and leave of absences are contributing to the void. Despite the extra help part-time staff, the division continues to be challenged in meeting its priorities. Tina's extensive experience and knowledge will fill an immediate gap to ensure ongoing payroll deadlines are met. Her support will be required until the division is adequately staffed and fully trained. And I thank you for your consideration, and I'm available for any questions.
Thank you, Kashmir. Any questions by the board?
No questions, just for the record, Kashmir Gill is a CPA. Thanks, Kashmir.
Thank you. All right, we'll open it up to the public. Any questions or comments from the public? Okay, seeing none, I will bring it back to the board.
Motion to approve.
Second.
We have a motion by Supervisor Chiesa, a second by Supervisor Condit, and we will have a roll call vote.
District 1 Supervisor Condit?
Aye.
District 2 Supervisor Chiesa?
Aye.
District 3 Supervisor Withrow?
Aye.
District 4 Supervisor Graywall?
Aye.
And District 5 Chairman Condit?
Aye.
Thank you.
Thank you, Kashmir. And we started with Tony, we're going to end with Tony today. So we have a PowerPoint presentation by Tony Barton, and it is in regards to settlement funds awarded to Stanislaus County to behavioral health and recovery services.
Thank you very much again, Chairman Condit, members of the board, CEO Hayes, and County Council Bose. We appreciate it, and yes, I'd like to turn first to CEO Hayes before we start our presentation.
Thank you so much, Tony. So I'm just going to take a moment to set the stage for what we're doing here this morning, and I just want to share a couple things. First is that I am personally very, very excited to be having this conversation with the Board of Supervisors this morning and our community. It's been quite some time, but quite a while ago, we challenged ourselves and this entire team, the brain trust of our SUD services here in Stanislaus County, to envision the best possible system we could to support individuals and families in Stanislaus County that are struggling with substance use disorder. The premise that we started with and continues today is that this is one of the most significant issues in our community that impacts families and individuals and has direct impacts on the quality of life of everyone in our community in some way, shape, or form. And also the recognition that these types of services have been woefully underfunded throughout the entire state of California for decades. So they've more or less survived just off of the leftovers in terms of funding streams and so forth. And even with that, we wanted to at least establish what was the vision. If we put ourselves in the shoes of those individuals and families impacted by SUD issues, what system would you want to see? What would that look like? And in establishing that vision, we could then at least challenge ourselves to turn the dial every year as much as possible to reach that end goal. We believe strongly in the work that we do here requires a clear definition of what does success look like in all of our efforts and initiatives. And today you're going to see for the first time, I think, in total, what does our success definition look like for our SUD treatment systems. That doesn't mean there hasn't been a lot of work that's already occurred. I was pleased to see in this agenda item staff recognize some of the work that's already done. I think it's built into this presentation as well. We've brought on an entire new funding stream that's come on board with the Medi-Cal ODS system. These are all new things that have occurred since we set about challenging ourselves for that future system. But I did feel it was really important and that this team has developed the vision along well enough now that even though we're not ready to completely operate that entire vision, I thought it was very important that the entire community see it. So that's what's going to be before you this morning and what was built into this agenda item. Before Tony and team go ahead and get this started, I know we just have a few folks here doing the presentation. But I am absolutely thrilled to see the brain trust that came in this morning to support the team that's presenting. Some of the folks in this room have worked on this visioning for quite a long time, actually. I see Don Verselli, our retired SUD managers over here, supporting the effort, continues to support this system, even in her retirement. A lot of folks have come in and out of these conversations. Of course, Tabitha and Robert are running the system, and I think Tracy's new to the management ranks in our SUD system here. A lot of the coordinators are back here with us as well, and they're all supported by the executive team at BHRS as well. But I just want to thank them all for being here. Very, very strong show of support. You have in this room as much horsepower as you would ever want in terms of what we could do to support our community as it relates to SUD. So it's all yours. Thanks, Tony.
Thank you very much, CEO Hayes. And I'd like to really mention that, the true vision of this system that has been designed is actually CEO Hayes. He's just not mentioning that. So I want to give credit to the CEO Hayes for his vision and foresight on this UD. As we know, every county, every CEO in different counties and systems of care, they look at parity of substance use disorder services and mental health services, but you don't really see very many CEOs getting involved in actually creating the vision. So I want to thank you, CEO, for your vision that's been worked on for a number of years here. And then, of course, give credit to our staff who have been doing the detail work. And as you mentioned, we do have a lot of our coordinators and managers up in the back, as well as the Dr. Cross, the medical director for our SUD division as well, is here. So with that, a couple of things we're going to do today. Here at the front, I have, of course, Tabitha Sprague, who's the manager for and system of care chief for the SUD, as well as Kara Angano, who is the assistant director for BHRS. They will help with this presentation. We're going to actually give the gist of it to Tabitha. She's the expert. And but a couple of things. One, part of our presentation will actually talk about the state and local and tribal government action that took place where a lawsuit was brought against the pharmaceuticals and the drug distribution companies that alleged manufacturers actually did the prescription of, when they were doing the prescription of opioids, they were actually grossly misrepresented the risk of the long-term use of the opioids. And of course, that also they failed to monitor the suspicious orders that were out there. So with that, that contributed to the overall opioid epidemic. And then a lawsuit was filed by the state, local, and city officials, which manufacturers then came offering a settlement in lieu of further investigations and litigation actions, out of which we're going to be talking about a piece of our presentation is going to focus on some of those settlement funds that our county will be receiving. And then, of course, our second part, we will highlight what CEO Hayes mentioned about our ongoing progression of SUD services expansion. And we kind of will do a comparison of what we were and where we were back in 2019 before we actually engaged in drug medical organized delivery system. And you will see a lot of buildup following that engagement. And then, of course, last we will be sharing the vision that CEO Hayes mentioned in detail, which will be, I would say, a model of care, potentially and most likely for the counties, because we're talking about an approach that is basically payer agnostic. And this is going to open the path for our community to walk in and receive services regardless of payer source. So with that highlight, I'm going to go ahead and first hand it over to Kara. She'll cover a little bit about the potential funds, the proposed funds, how much we're talking about, and then she'll pass it on to Tabitha, and then we'll be here to answer any questions.
On July 21st of 2021, announcements were made regarding proposed settlements with opioid manufacturer Janssen Pharmaceuticals and 3 of the distributors, McKesson, Cardinal Health, and Amerisource Bergen, and collectively they're called the J&D settlement agreements. California is expected to receive approximately $2 billion, which will be paid through 2038, so almost 25 years. The majority of funds will be provided to participating subdivisions, of which Stanislaus County is one of the subdivisions. We here locally in Stanislaus County are anticipating to receive approximately $28.7 million in opioid settlement funds from the Janssen and distributors settlement agreements over an 18-year period. Also, back in 2020, in March of 2020, Mallinckrodt PLC, and I hope to gosh I'm pronouncing that correctly, another pharmaceutical manufacturer announced that an agreement had been reached to settle all opioid-related claims against that company and its subsidiaries. Stanislaus County anticipates receiving approximately $1 million in opioid settlement funds from the Mallinckrodt settlement over an 8-year period. There are also other pharmaceutical manufacturers, 2 that we know of right now, Allergan and Teva, and then 3 pharmacy chains, CVS, Walgreens, and Walmart, that have announced settlement agreements, and it was in late 2022. It's quite a significant amount of funding that's expected to be received, but our specific allocations to Stanislaus County are not yet known. We are actively, as a county, participating in additional opioid settlement actions in order to obtain funding for local opioid abatement activities. If additional funding materializes, BHRS plans to return to the Board of Supervisors with an updated spending plan for the board's approval. And so we are here with you today to request that the board authorize the designation of those opioid settlement funds to behavioral health and recovery services so that we can utilize them in allowable abatement activities for opioid. And I will turn it over to Tabitha to talk about some of the things that we've identified in collaboration with the Chief Executive Office as priorities.
Thank you, Kara. So I'd like to start with a little bit of the history of substance use disorder treatment services provided by Behavioral Health and Recovery Services, because I think it'll allow a better understanding of why we're requesting what we are. Prior to the launch of the Drug Medi-Cal Organized Delivery System in April 2019, there were 3 types of services that were covered for Medi-Cal beneficiaries. That was opioid treatment programs, which are the methadone service delivery providers, perinatal treatment programs, and outpatient and intensive outpatient services. Perinatal treatment programs were covered during pregnancy and 60 days postpartum, and after that was left to other types of funding, which was very limited, or cash pay by the individual needing services. Outpatient and intensive outpatient treatment services were funded at a rate that was lower than the cost to provide them, and resulted in individuals having to pay co-pays or BHRS having to subsidize those treatment services with very limited grant funding, or again, cash pay for individuals to get those services. This is a good visual of what services looked like prior to the launch of the Drug Medi-Cal Organized Delivery System in April of 2019. As you can see, the blue areas are the covered services that I spoke to for both youth and adults. The gray shaded areas is what was not available to our community members and our Medi-Cal beneficiaries. Since the implementation of the DMC ODS on April 1st of 2019, we have significantly expanded access to a larger continuum of care. We have a network of providers for Stanislaus Medi-Cal beneficiaries, uninsured and underinsured individuals from both county-operated and community-based organizations. Our expansions included all mandatory adult substance use disorder treatment services or levels of care are now available. Youth services were expanded to include various intensities of outpatient treatment services, medication services, and ambulatory withdrawal management. Telehealth service options are now available, and perinatal services have expanded to be covered for an extended duration of time past that 60 days postpartum. Just in the past year, our expansion efforts included increasing our network of residential bed capacity by 12 beds, adding high-intensity residential level of care options for females, the addition of dependent child placement options for females in residential treatment services, the addition of a residential level of care for special populations, increasing youth outpatient treatment options by the addition of a new contractor and through a collaborative agreement with Merced County, increasing sites supporting field-based treatment access for youth by our school site availability, a net increase of narcotic treatment program capacity, the addition of youth medication-assisted treatment services, the addition of a standalone medication-assisted treatment clinic that has the ability to prescribe medications other than methadone for the treatment of substance use disorders, and a piloted use of our recovery housing for individuals needing short-term safe environments in which to live in during ambulatory withdrawal management services. Although that is a significant increase and a significant expansion of access, there still are some gaps in our continuum of care and some opportunity for growth for our system. Those opportunities include the addition of youth recovery residences, residential withdrawal management for youth, expansion of current capacity within the system, and integrated streamlined access services for all community members. The importance of the need for continued expansion cannot be understated in the context of the opioid crisis. Of particular note, there are severe consequences the opioid crisis is having on our community. Opioid-related overdoses and accidental poisonings have continued to rise with the increasing presence of fentanyl in Stanislaus County, as noted on the overdose and poisoning death coroner data that is displayed here. The data demonstrates year-over-year increases in overdose and poisoning deaths in our community, with fentanyl being a driving force of that. The 2021 annual crude mortality rate is an increase of 133% since 2019. Additionally, Stanislaus County has one of the highest non-fatal overdose and accidental poisoning rates in the state of California. The continued loss of life, as well as other impacts to the health and well-being of community members, underscores the need for increased efforts to expand access to substance use disorder treatment services. Department of Healthcare Services, California Advancing and Innovating Medi-Cal, or CalAIM, is a long-term commitment to transform and strengthen Medi-Cal. The gist of those efforts and the goal of CalAIM is to provide more person-centered care, coordinated care that has more consistency in a seamless system so that enrollees can actually navigate the systems that they need to in order to get the holistic care that they need. The goal is to decrease the complexity of those systems and to increase the flexibility of those systems so that individuals can get seamless, easy access to timely services to meet their needs. BHRS proposes to leverage those new flexibilities. We would like to implement new substance use disorder services, expand existing services in our network, as well as take an innovative approach to streamline and integrate services and improve our access for our community members. Right now, there's a complex means for individuals to access services. If you are in one system, you go here. If you're in another system, that you go there, and it's very confusing to people. When it comes down to it, we've heard feedback from a variety of different stakeholders that we need simple, accessible services. We're proposing an innovative approach in which we provide that accessibility to our Drug Medi-Cal organized delivery system beneficiaries as well as other community members through a public-private collaborative. We foresee that achieving these goals will ultimately result in the following benefits to the community. Easy access, 24/7, 365 days a year access to a treatment system that is well known throughout the community and accessible to everyone regardless of what their pay source is. Real-time screening and assessment that would triage individuals who have a need for services, provide them the most appropriate level of care and treatment services within 24 hours of a request, and provide care coordination from the moment that services is requested throughout their transition through different levels of care to meet their needs, ultimately eliminating a wait for services. Treatment services would be available to everyone. The Stanislaus County would look at maintaining a network of services that has adequate capacity to meet community need, and expand to meet community need if necessary at various levels of care that are needed. And comprehensive services for sustained recovery, meaning a broad and comprehensive area of services would be available to assist individuals to achieve and sustain their recovery. We envision it would take a phased approach to achieve this. We would launch an integrated care center, expand adult services, implement the integrated care center, expand youth services, and expand additional services, including in-custody services. Phase one of the proposal is to develop what we are calling an integrated care center, or the ICC, that is a public-private collaborative. We're proposing a partnership with private insurance organizations, managed care plans to ensure ease of access for all community members. Stakeholder feedback regarding the difficulty in accessing services, including from our Opioid Coalition and fentanyl town hall meetings, informed us in the development of this concept. The ICC will be a centralized access point in addition to the current drug Medi-Cal organized delivery system access points for evaluation, assessment, and navigation to the necessary care. The ICC would remove confusion and barriers for community members seeking services and ensure that services are seamless, again, from initial contact throughout their treatment services, regardless of payer source. ICC services will provide same-day screening, assessment, and referral to services and support community members with navigation of their health plan, the drug Medi-Cal organized delivery system, and there will be a variety of services provided within that center. First and foremost, a 24/7 respite and stabilization center would operate 24/7, provide short-term recovery and recuperation from effects of alcohol or drug intoxication. One challenge that comes up when speaking to these centers is the individuals accessing those services, there being a concern of the complications that can happen when somebody is under the influence and they begin physical withdrawal. We would have staff to provide oversight of those individuals, monitor them for experiencing withdrawals and connecting them to necessary services if needed, and to also be there to engage them with substance use disorder treatment services. The hope is that a respite stabilization center will divert folks from the criminal justice system, mental health treatment systems, ease emergency room department overcrowding, and to support individuals in getting the help that they need. Another component of the ICC is a drop-in center. Although we have a drop-in center in our current DMC-ODS, this drop-in center would be payer agnostic and open Monday through Friday. There would be various SUD groups, resources, some structured activities, and peers there to assist with navigating folks to the services that they need. We would also co-locate our evaluation and medication access clinic. This clinic provides, and we refer to this as EMAC, this clinic provides outpatient medication-assisted treatment, including options for alcohol use disorder, opioid use disorder, and other substance use disorders. EMAC is classified as additional medication-assisted treatment by the Department of Health Care Services and is approved and able to provide all FDA-approved medications to treat substance use disorders other than methadone. Methadone would continue to be provided on our narcotic treatment programs. We would also co-lead our care coordination team at the ICC, and that would expand our primary access point for substance use disorder treatment services in order to support payer-agnostic same-day access to screening and comprehensive assessment and allow timely placement in whatever services are deemed appropriate to meet an individual's needs, as well as to provide case management services to avoid crisis, high utilization of services, and disengagement from services. Most importantly, stay with folks continuously to keep them engaged as they transition through care within the system. Another exciting option that we can add to our ICC is an outreach and engagement team for SUD, which has not happened before in the past for us, so that's a very exciting opportunity. That would include meeting folks exactly where they are at in the community and ensuring that we are able to get to them where they are, provide screening, assessment, and referral to services that are necessary, including the provision of overdose prevention resources like Narcan and fentanyl test strips, and that would ensure access to services throughout the community. The outreach and engagement team could drive someone to the ICC, they could drive them for an intake and appointment at a treatment program, or they could just connect with them in the community and begin an engagement process so that those individuals know that we're here to support them. There's additional options to co-locate health plan services, including enhanced case management, medical providers, and any Indian healthcare plan liaisons so that we can ensure access to tribal services. BHRS is proposing that the expansion of the services be implemented in 4 phases. Phase 1, as spoken to, is the primarily focusing on the planning and development of the ICC and the expansion of services to adults, including recruitment of a team to oversee development of the ICC, establishing partnerships and building stronger relationships between public and private organizations, developing a fiscal model, and identifying appropriate site for the integrated care center. And for adult expansion services would be expanding our opioid treatment program options, expanding our residential capacity, expanding withdrawal management options, and expanding recovery residents' access for individuals who are choosing outpatient withdrawal management options and need a safe place to stay. Phase 2 would be implementation of the ICC and co-locating our care coordination and evaluation and medication access clinics at the new site. It would be development of our satellite access points throughout the community, as well as requesting staffing resources to support the ICC programs. Phase 3 would be the planning and collaboration to launch a youth ICC for our youth system, as well as expanding youth services, including establishing local youth residential and residential withdrawal management services. Currently, youth can only access those services in Southern California. And the expansion of recovery residences or recovery housing for access by emancipated youth that need those services. Phase 4 would focus on continuity of care needs for justice-involved individuals, which would include identifying funding to support medication services in custody, including continuity of care for individuals entering custody that are already receiving medication services and those that are leaving custody that may have had them initiated, as well as supporting initiation of medication services while in custody. We envision that once all of these phases are implemented, our DMC ODS treatment system will include a broad continuum of care and expansive services, as well as integrated access for all community members so that anybody in the community can have their needs met. The integrated care center would be the payer-agnostic access hub for anybody in the community in need of SUD services. Stanislaus Recovery Center would be the BHRS-operated treatment hub for SUD services. And the remaining DMC ODS providers within our network would offer choices for medication services at multiple narcotic treatment program sites, our standalone medication-assisted treatment, and telehealth access to medication services. Choices for residential services through expansion beyond the current 4 sites that are offered, including gender-specific perinatal, dependent child components, and faith-based options. Various levels of outpatient treatment services at over 8 treatment sites, field service access at satellite locations, which include school sites, and specialized programs for youth, justice-involved individuals, and perinatal populations. BHRS will have to continuously evaluate capacity needs for all levels of care and treatment interventions to make sure that the public and private networks are adequate to meet community needs, as we anticipate that increasing access and making access a little bit easier could result in increased need for treatment capacity. And so I will hand this back to Kara.
Implementation of the ICC will require extensive site, system, and process establishment to expand treatment service access and comply with federal and state regulations. It will also require significant coordination with partner agencies in order to develop the payer-agnostic system, which Tabitha talked about. BHRS is requesting the addition of one block budgeted manager 123 and one mental health coordinator to lead the ICC implementation efforts. The manager will provide administrative and clinical oversight over all components of the ICC once implemented. The mental health coordinator will oversee day-to-day operations of the respite and stabilization center, as well as the drop-in center once implemented. The 2 recommended positions will be added to the substance use disorder legal budget unit. The annual cost is estimated to be $376,000 per year, as shown on the screen. The positions will be funded by a combination of opioid settlement funds and DMC ODS administrative federal financial participation. Stanislaus County anticipates receiving $28.7 million from the J&D settlement agreements over an 18-year period, which is an average of approximately $1.6 million per year. The Mallinckrodt settlement agreement will result in approximately $1 million over an 8-year period, an approximate annual average of $125,000. BHRS will develop a spending plan for the opioid settlement funds as outlined in phases 1 through 4 and return to the Board of Supervisors for approval. As additional settlement amounts are known, the department will update the spending plan and also return to the board for approval. At this time, there is no impact to county general fund for the proposals that we're putting forward. We have 3 staff recommendations today. The first one is to approve the designation of approximately $28.7 million in opioid settlement funds from the Janssen Pharmaceuticals, Inc. and Distributors Settlement Agreement and approximately $1 million from the Mallinckrodt PLC Settlement Agreement to Behavioral Health and Recovery Services for use in allowable opioid abatement activities. The second one is to authorize the Behavioral Health Director to develop a spending plan for the OSF to expand substance use disorder services and perform other allowable opioid abatement activities and return to the Board of Supervisors for final approval. And the third, amend the salary and position allocation resolution to reflect the recommended changes outlined in the staffing impacts section of this report, effective the first full pay period after Board of Supervisors approval. That concludes our presentation, and staff are available to answer any questions that you may have.
Thank you very much for your presentation. Do any board members have any comments or questions? Terry?
Yeah, if I could, I'll just start off here, just a few comments about, first I want to, this is just unbelievable, what you guys are proposing here and where this is going, and just so thankful, thank God, thank you guys for us getting to this point. First I want to talk about, we talk about this funding that's coming, this that's falling in our laps, the settlements, what is it, opiate settlement funds, OS, is that right? Opiate settlement funds. You know, it's similar to the tobacco funds, right, that we got prior to, I think, any of us getting on the board, the tobacco funds. And just, I want to recognize Supervisor Chiesa for what we talked about this couple of years ago, was it? A couple of years ago when it first came out, 4 years ago. And yeah, because at the time it was myself, Vito, and Kristen Olson, Dick Monteith, and Jim were on the board. And so we talked about these funds. And my initial reaction, along with Jim and Kristen Olson's, was, you know, why get on board with this? We're always trying to blame somebody. And why should we go after these funds? We don't want to be a part of it. Vito, in his wisdom, and that's what's so great about our board, I feel like, is that we all have our expertise. Vito's the guy that finds the money, and then he goes and works the people and figures out how to get it there. Our negative bailout, all those things that we've, over the years, money that's come to this county. But we outvoted him. We said, no, we're not going to do this. but he continued to push as this came back to us again. And I just want to recognize, thank you for correcting me in my wrong, because we would have never had this funding if we hadn't have had you kind of pushing us to say, no, this is the right thing to do. And as I came around more and more, there's a series on Netflix called Dope Sick. You need to watch that. And that will convince you that what was done here was criminal with these opioid funds by some of these large drug companies. And so anyway, first of all, thank Vito for what you did. And that's what, you know, I'm out there always running around homeless, trying to work on all these things. But if you don't come up with these funds, we can't do anything. And so I very much appreciate you doing that. The next thing I want to talk about here, sorry, as if this meeting isn't long enough, I just want to talk a little bit more. We have, for years, recognized in this county that the individuals, and when we talk about our homeless, it is a drug, alcohol, for the most part, it is a drug and alcohol and mental health issue that we're dealing with these individuals that are on the streets. There is the economic side for sure, and the shortage of housing. But I would make the argument that if individuals did not have drug, alcohol, and mental health issues, their family and friends would step up and take care of them and keep them from becoming homeless. And what ends up with a lot of our individuals being homeless is because they have exhausted all of their family and friends, because of their mental health issues or their drug and alcohol issues. And that has landed them on the streets and put them where they are. And I would then argue that if we could fix those issues, those friends and those family would come back. I know now there are individuals who come from families that we don't want them to go back to, and that is not the case. But there are a lot of people out there that will step up and help individuals if we can help them with these issues. We had a blue ribbon committee that the governor, I can't remember if it was Newsom or Brown, had sent here to our county because we were supposedly we were leading in the homeless crisis and the way we were dealing with it here. And they sent a committee here. I think Darrell Steinberg was the head of it, and Mark Ridley Thomas, I think. And they came before us to see what we were doing here. Well, they really didn't come to ask us what we were doing here. They came to tell us how it should be fixed. And I can remember standing in front of them and then telling me that that it's not a drug, because I was saying we have drug, alcohol, mental health issues. And I remember specifically Steinberg telling me that it's not that's not the issue, that it's an economic issue, and that if we can just get housing for these individuals, we can solve this entire thing. So it's great now to see the state is finally coming around and realizing that it is, for the most part, a drug and alcohol and mental health issue with our individuals that are on the streets. And actually, through the CARES Act was the first signal that they realized that that's okay. Now there are mental health issues, and maybe we need to figure out a way to get these individuals off the street involuntarily, even though we're a long ways from where we need to be to do that. The CARES Act is heading us in that direction. Now there's actually legislation that they're starting to look at that says substance use disorder. We need to figure out a way to deal with these individuals' substance use disorder, get them off the streets, figure out how we can do that. I still argue that most of them have warrants, and there's ways for us to get them off the street, not to put them into jail, but to get them into services. We need to forcibly figure out a way to get individual services. And I understand that you can't force somebody into drug and alcohol services. They need to get there themselves. I get that. I've lived with that. I lived with that with my dad. It wasn't until he realized that he was hit rock bottom before he needed those services. But the stuff that we're doing here now with this expansion of our services is getting us in that direction. It's just amazing, you know, that we're going to get there. The Integrated Care Center, unbelievable. Just what we need to get there. We've got the funding now. We have some funding now with this opioid settlements. We will find additional funding, I know, to do this stuff as we continue and want to expand in these additional phases that we talk about here. But I couldn't be more proud. Again, this is a proud day. Just great stuff coming from you guys. The stuff you're doing, the things you're putting together is really going to change this community. It's going to change individuals' lives, which will change their community. And there will be dividends on the money that we spend now to repair these individuals' lives, will then pay dividends to us tenfold over. I've said this 100 times, but if we can stop having to incur the costs that we're incurring and having to deal with these individuals on the streets on a daily basis, we will get a return on our investment 10 times over. We will pay for these services that we're going to provide. So this is just good stuff. And all the efforts that everyone has done and made and time put into to get this going. I know we have a long ways to go, and this is, Jody, you won't have to hear from me anymore. I know you're tired of me continuously harping about these things, that this is the way we need to do. I am so happy to see us heading in this direction. And I just thank all of you for everything you're doing, and I just look forward to the results we're going to get from this work that we're doing. So thank you very much.
Thank you, Chair. Vito.
Thank you very much, Mr. Chair. So I thought, Tabitha, when you finished, I thought that I needed to stand up and give you a standing ovation, because we build programs based on how much money we have, and we never build the perfect program from the start and say, what can we fund, right? But this is what's ideal, and this is what it's going to take to make an ideal system. And I thought what I heard today was an ideal system, where you go and meet people where they are. You can grab someone at the bus stop when they get off the bus, and if they have issues, we can take them somewhere. There's a place, because so often we have capacity issues. That's been the bottom line for many, many years. This funding source, and I don't agree with Terry, this is a collective effort of everyone realizing. I think there was that one graph on what fentanyl has done to our community in 5 years, from 10 to 120, I can't even remember the number, but more than 10 times in 5 years, more than 10 times more people have died from fentanyl. And so we knew this was coming, and we just haven't been able to stop it. So this is a part of the penance of these companies that have taken advantage of people, and it's going to be a funding source that will allow us. I don't want people, because it sounds like a lot of money, $28 million over 18 years. These people are really smart. $1.6 million today is going to be worth $600,000 in 18 years. So we have to figure out other ways to staff and make this work. But I just like the program that was brought forward. It is so complete, and very rarely we see that. Again, I'm going to come back to, if we had $1 million, we know we can hire 3 mental health clinicians and a manager, and we can have this space, and that's where we find the best bang for our buck, and instead of doing it longitudinally like this. And to all of you folks who've stayed out here for the last 3 hours, this again shows the board how important this is to you, and we appreciate you spending some time with us. It truly means a lot, and just a big thank you. I think we're on the right road.
All right, thank you. Since there are no further questions or comments, I will open it up to the public. Any members of the public wish to comment on this item? Yes.
James Costello, another hat I wear. I've been a pediatric physician's assistant for 40 years, and personally, it was really hard to get certain mental health services for kids. This looks like a possible answer to that, and it's really exciting to see this coming. I had a personal experience just last Friday. A man who we know in our neighborhood is a meth addict, and he showed up at our house because we've helped him before. On a meth trip. So we had to figure out what to do. We were going to call the police, and then we said no, because he was okay. I mean, he wasn't violent or anything. Well, we live about half a mile from the Stanislaus Behavioral Center retreatment program, or not behavioral, not on clause, but in series. So I ran over there. I said, well, let's go over there. He'd been there before, so that was good. So we went over there. It was 5 o'clock. The signage there is not real conducive to someone trying to get help. And we ran around. It's a big facility, found a door, phone numbers to call. All the phone numbers went to voicemail. Leave a message. Finally, I happened to run into a lady exiting the psych facility, and I said, well, I've got a man who needs assessment. Where can we go? And well, she gave me a number to call. Well, I called a number. It was on, message, leave a message. So then luckily I nailed her again. I said, well, they're busy. There's a message. And said, well, go to the CERT unit. So I went around to the CERT unit, and the signage there isn't really, you don't know which door to go into. It's very barren. Finally, I found a door, knocked on it, security guard came out, and luckily there was a nurse there, and she came out and assessed him on the spot and admitted him. And so I'm sure that in this plan, that kind of thing, making it will be much more easy to get assessments, probably. And I asked her, what normally would you do on the weekend when, she said, well, normally you'd go to ER, DMC ER, the doctors would assess him and then they'd be transported. Well, luckily it worked out for us. So thank you for doing this, and thank you for listening. Thank you.
Thank you for your comments. Any other members of the public wish to comment on this item? Okay, I will bring it back to the board, and it is a 4/5 required vote.
I will make a motion that we approve staff recommendations.
Second.
Okay, we have a motion by Supervisor Withrow, a second by Supervisor Condit, and we will have a roll call vote.
District 1 Supervisor Condit.
Aye.
District 2 Supervisor Chiesa.
Proud aye.
District 3 Supervisor Withrow.
Aye.
District 4 Supervisor Graywall.
Aye.
District 5 Chairman Condit.
Aye. All right. Thank you, Tony.
Thank you very much. I just want to make a comment and thank the board for your leadership and support, continued support, CEO Hayes for your vision, and all our staff and leaders from SUD who are here and who have really stood behind this initiative. I think that we're committed to solve the issues in our community, and we'll continue to work and to do that. Thank you very much.
Wonderful. Appreciate all the work. All right, moving on to correspondence.
This board has received the correspondence and claims as listed on the agenda.
Acknowledge receipt of correspondence and refer as recommended on the agenda. All right, Board of Supervisor reports.
I'll just quickly say that the Houston Fruit and Nut Festival went on this weekend in Houston, and it was a smashing success. I think they had good weather, but there's just so much pent-up energy for people to get out and do things. And then Maria Sali was honored for her lifetime dedication to the Houston Fruit and Nut Festival. And anyone who doesn't know Marie, she's done so much good for the community, not just of Houston, but Turlock Community Theater, the United Samaritans, and lots of other things. But it was, I was very honored to present her with a certificate on behalf of the board.
All right, and I had an eventful weekend as well. I attended the Patterson Joint Unified School District Special Olympics. It was very inspiring to see those amazing athletes out there, and it was their first annual Special Olympics for Patterson Unified. They did a phenomenal job putting that together, and I look forward to next year. Among that, I attended Love Series over the weekend as well, participated in the downtown cleanup efforts. I know we're getting ready for the Series Street Fair this Saturday, so we're going to be welcoming thousands and thousands of people to downtown Series. So Love Series did a great job of all their projects throughout the city, and I was happy to be a part. Also this weekend is the SMBU Cinco de Mayo Parade for South Modesto, and that will be taking place down Crow's Landing Road, and I look forward to being a part of that parade as I was last year. So hope to see you all out there. All right, that concludes Board Supervisor reports, but I do want to ask our legislative partners if they have anything to report. Gavin? Good afternoon now.
Good afternoon, Chairman, Board, members, county staff, members of the community. Thank you. Quick update from our office. As we're looking down the barrel of a potential catastrophic flooding in the valley this summer, early last week, Congressman Duarte was able to question USGS Director Applegate about the federal government's preparation efforts and in ways we can prevent future flooding from happening in the future. Congressman Duarte helped pass the Limit Save Grow Act. The goal of this bill is to lower the prices of gas, groceries, and create more high-paying jobs working to get our economy back to normal. This week, the House Natural Resources Committee continued its discussion on Water for California Act. We have the resources, methods, and ability to fix California's water storage issues. The Water for California Act lessens permitting requirements and embraces abundance. More water means more affordable housing, cheaper groceries, and more high-paying jobs. Wineries are very crucial to the valley. This week, Congressman Duarte met with representatives from Napa Valley Vineyards, a trade organization that represents over 500 wineries throughout California. Discussions were of funding for emergency relief programs, fire prevention, in the upcoming Farm Bill. I also want to thank all the organizations that were involved with Love Stanislaus. I was able to participate in Love Patterson. It was a great event. And just want to say thank you to all those in our office. Was honored to be a part of the county's big day. Thank you all for your time.
Thank you, Gavin. Abby? And Bob, you got anything? Okay, go after Abby.
Good afternoon. My name's Abby, and I'm here representing Assemblymember Juan Alanis. So this weekend we participated in Love Patterson. We also participated in the Tea and Talent Show hosted by the City of Ceres. The Young Ladies Institute of Modesto celebrated their 100-year anniversary, so we attended their luncheon. American Petroleum and Convenience Store Association had their 10-year anniversary, so we attended that. We also recognized 4 Ukrainian mayors who participated in the Open World program sponsored by the Congressional Office of International Leadership, hosted by the Sister City International. And then upcoming this week, we have 3 mobile district offices throughout the district. So we have one in Patterson tonight at 5:30, Denair on Thursday at 9 a.m., and then also in Turlock this Thursday at 2 p.m. For locations, we have those available on social media, so if anyone would like to attend those and get some resources from our office, those will be available to you. Thank you.
Thank you, Abby. Bob?
Old school, don't have a phone with all the information on it, just have it in writing. But I do want to say again, good afternoon, Chairman, members of the board, and staff and public. It's been a busy couple of weeks in Washington, D.C. H.R. 734, which is the Protection of Women and Girls in Sports Act of 2023. So the bill prohibits school athletic programs from allowing individuals whose biological sex at birth was male to participate in programs that are for women or girls. That's pretty much a common sense issue there. And on 419, the House Judiciary Committee approved the Border Security and Enforcement Act of 2023. Congressman Tom McClintock and Arizona Rep. Andy Biggs introduced the legislation to combat record levels of illegal migration under the Biden misadministration. The legislation passed on a party line vote of 23-15 and will advance to the House floor. And it's great listening to you when you're all talking about your budget. I wish we had people like you in Washington, D.C. and those numbers you have. Because the House GOP passed a budget this year, 217 to 215. And if you look at those numbers, if John Duarte and Tom McClintock were there, we'd still be doing the continued resolutions and not actually getting down to addressing the budget and the issues we have. And what that budget does, it freezes spending at 2022 levels, adopted in fiscal year 2022, and caps spending increases at 1%. Now, Biden had said he was not going to negotiate. It's been over 80 days. And because of the fact that they did get this through, they are going to meet on May 9th, and they're going to actually negotiate on the budget. They're going to actually get it before the people. Because I don't know if you've ever taken a look at the national debt clock, if you really want to get upset. Our national debt this morning was $38.7 trillion. Our spending this year for the United States is $7.2 trillion. Tax revenues coming in is 5.7. 7.2 going out, 5.7 coming in. We obviously have to do something. But just to let you know, because you'll all be happy about this, each one of you owes $111,000. And it's not going down. But I do want to say that Congressman Tom McClintock, for the first time, voted for the debt limit increase because of the fact he believes the GOP plan has concrete provisions addressing overspending. And then probably one of the most important things, May 14th is Mother's Day. I'd like to say Happy Mother's Day to my wife, to the staff here, to you and your wives and your mothers, and just thank you for being here and for putting in this long meeting. You guys have earned your pay today, and just thank you for being here.
Thank you, Bob. All right, we'll move on to Legislative Fiscal and Management Report, and we'll just roll that into announcements as well. CEO Hayes.
I don't think I can outdo the Mother's Day shout out, so shout out to the moms coming up here. So just real quick on the legislative update, we're preparing, eagerly preparing for the governor's May revised budget that we expect on May 10th. The Senate Budget Committee has released an initial budget plan with some of their proposed solutions, but it really is the governor's May revise that's going to tell us what direction the state budget is going in. There are a couple of specific programming issues in there that are going to be very important to counties. So we'll report out as soon as we have more of that information. Also very, very excited to announce for everybody that we have the State of the County address coming up by our very own Chairman Chance Condit here. We're excited to see that on Tuesday evening, May 16th, 2023. We'll start at 6:30 p.m. The State of the County will be here in the chambers of 10th Street Place, and we look forward to it. I presume you're all set to go. You ready to go right now with that, or are you still prepping?
I want to know what is the shortest State of the County address, because that's the mark I'm going for. So if we can maybe do some historical research there on what is the shortest, I'm going to probably be about a minute under that. So we're excited, and it should be a fun evening. But I definitely have a large mountain to live up to with the past two State of Counties, both by Supervisor Chiesa and Supervisor Withrow, so I hope to follow in their lead. All right, but moving on to closed session. We do have closed session today.
Yes, we have a closed session, conference with legal counsel, existing litigation pursuant to Government Code Section 54956.9, Subdivision D1. We have two cases there, Donnie Woodrow versus County of Stanislaus. It's in the United States District Court, Eastern District, and case number is 120 CV 00372. The other case is Lisa Marie Gill et al. Versus County of Stanislaus. That's in the Superior Court of the State of California, and that case number is CV 20-002901. The second item that's on the agenda, the conference with legal counsel, initiation of litigation pursuant to Government Code Section 54956.9, Subdivision D4. We're going to take that one off the agenda, and we'll bring that back at a future meeting.
All right. Does any members of the public wish to comment on closed session? Okay. Seeing none, we will adjourn this meeting at 12:25.